oftentimes there's a reason that they give us as to why they need to go to the hospital, and we take those reasons very seriously. But at the end of the day, most of them are just needing a shelter, and we take them to the hospital. It takes up an EMS resource. It takes up the hospital resources when we get there, and oftentimes it's the EMS crew is waiting for potentially hours in these hospitals because their patient is of a lower acuity, and not able to get back onto the streets. We're also seeing an issue in EMS where patients who can't afford housing often are letting their health lapse as they can't afford to take time off of work, as they're on that fringe of being homeless. And there's so many that we are seeing that are unable to take any time off of work or spend any extra time at the hospital to take care of their health needs, and eventually are ending up in the healthcare system anyways, and drawing off of it by taking acute care bed as they've let their, what I see very often is diabetes lapse. But there's a variety of health reasons that this happens. And oftentimes EMS is the only place that people can access the system. It's the only place that they know how to access the system, whether they need to talk to a social worker, get income support, whatever it is. Oftentimes they know that EMS is the place that is the system that will take them to the hospital where they can access those different things. We've seen, in my personal experience, I've seen some people who are living very normal lives, and they end up homeless for a variety of reasons, and oftentimes it ends up in substance misuse, and that's drawing off of the EMS system. We are seeing increased rates of overdoses in our homeless populations, and right now we don't have the resources to even deal with the opioid crisis right now. And as you said, 70 deaths a month just in Edmonton alone, and it's showing. We often think of homeless individuals as people who need extreme help and intervention to live a normal life. That includes living in a suitable home by themselves. However, this isn't often the case. Many are only lacking housing from what I see in my profession. Once they get that housing, they are able to get stable income. They're able to get their health stabilized, their mental health, prescriptions. I've seen housing stabilize many of our regular clients that we see in EMS. I think that's all that I had here for today. Thank you for letting me stumble through that. It's my first time speaking to council here today. I appreciate your time.
Great, thank you. Thank you for being here. We appreciate your comments. Next, we have Bradley LaFortune joining us remotely.
Hello, can you see me and hear me okay?
We can, yes. Thank you for being here.
Thanks, Mr. Chair. Hello, councillors. My name is Bradley LaFortune. I work as the executive director of an organization called Public Interest Alberta. I'm joining from Treaty 6 in Hamaskwachi, Wisconsin, here in Edmonton. Here to talk about housing and public health today. I've been working for the last couple of years on human services and poverty issues, and specifically focusing on housing, especially in Edmonton. It was really nice to hear the report from AHS and the Chief Medical Officer of Health for Edmonton, which really underlines that housing is healthcare, and that we do know the solutions when it comes to housing and easing some of the impacts that we're seeing on our healthcare system as a result of those services that are being provided for people who don't have adequate housing. But today, I specifically want to just underline what we're hearing as an advocacy organization and seeing when it comes to housing as an emergency in our communities. It's true that housing is always a foundational issue, but right now, whether it's affordability, adequacy, accessibility, habitability, or lack of wraparound supports and services, and also a shifting focus, quite frankly, to enforcement instead of upstream solutions when it comes to community well-being. We are in a true emergency. Affordable housing and adequate supports is obviously complex terrain, as we heard today, and we've been learning about for the past couple of years as we've been really digging into this issue in Edmonton. But it's also simple in a lot of ways as well. There are a few foundations that work, that if we follow, that they can provide an opportunity for Edmonton to address the crisis in houselessness, which will ease the burden that we're hearing about today on our healthcare system. But we need the province at the table in a meaningful way. And so my message today is for us to ask those tough questions, not directly to AHS, because it's not quite the provincial government, but to the provincial government. Because when we say that we need partners at the table, what does that mean? And are we really seeing it today? There's reams and reams of information to show that housing is a major factor in upstream health and public health. I was just going to share a paper with you after I stop yakking here that says that housing is a service provision that provides tenants experience and property quality housing in aspects of all of our neighborhoods, and that it's demonstrated to be significantly correlated with measures of health and well-being, and that the analysis of contextual factors provides additional detail that shows that the theoretical framework for housing offers very conclusive evidence that housing is a critical factor for public health and individual health, and also that it's related to impacts on our healthcare system, as we heard today from HS. So to me, it's very clear that our current efforts at finding an adequate partner in the province are simply not working. The major narrative about community well-being for Edmontonians is focused on public safety, and I'm really, really concerned that our current provincial government would like to make the cynical case that Edmonton is San Francisco of the North, at least the version of that city that exists in the minds of conservative and Republican activists. However, we know the major causes for deepening homelessness are not due to proven policies and programs that work when they go hand in hand and they're adequately invested in, but quite the opposite, a lack of those supports and services. So we need to advocate to the province that the stronger foundation needs to be thrown out the window, quite frankly. We need minimum shelter standards, as we heard today. We need a massive reinvestment in permanent supportive housing and near market housing. We need investments in wraparound supports and services so that those supports and services can walk alongside individuals when they're being housed and rehoused, so that we don't see a failure of housing first policies. So I'm going to wrap up there and stop yakking, but thank you very much for your time, and I appreciate the report from HS today. Thank you.
Thank you. We'll now go to questions of our speakers from committees, starting with Councillor Tang, who selected this item.
Great. Thank you so much. Thank you so much, everybody, for the presentation. Yeah, well, maybe I'll start with Tricia. If you want to finish some of your final thoughts in your presentation that you didn't get to, and I have a few questions for you.
Sure. Thank you for the opportunity to finish. Really, I just wanted to focus on a couple of additional things, and mostly on, so what do we need? The so what of all of the information is really a prevention as focus, and I think you've heard some of that from the other presenters today, is that we need hygiene assets, we need public bathrooms, we need showers, we need laundry facilities, but we need them permanently, not just when there's an emergency. There's very little of those assets in Edmonton, and most of them are inside shelters, which are only accessible in the evenings. Some in day programs, but there's very few of those. As we've probably heard, Operation Friendship just shut down permanently, so there's one less space for people to go. We need housing across the spectrum, so we need affordable market housing and or rent supplements. We also need supportive housing, but we need options to fill the gaps in between along the spectrum. And as you heard from Ms. Tash talking about medical respite and pregnancy pathways, those are two really good examples. You know, they're neither market housing nor supportive housing by definition. They fill the spectrum in between, and that's what we really need. And we need those wraparound supports, individualized to the person, that will shift as their needs change, because their needs will change. Their needs will be intense when they're first housed, and when they lose their housing, they need more intense supports to get housed. We need safe, warm places for people to go when they're not housed. And you know, we've heard a lot about that. And the last thing I'll mention is that we do really need integrated, accessible community health supports that can help, that are accessible to individuals at a community level, that have wraparound supports that are integrated with primary health care, mental health resources, and help to navigate the system, because it is complex. Thank you.
Thank you very much for that. And I think you've certainly, I think today's conversation is really about this intersection between province and municipalities and who plays what role. And you mentioned a few things, for example, public washroom, which is something that the city has been working on, and very much in terms of that infrastructure really needed, not only for the houseless, but for everyone, right? I guess I'm wondering if you can share some thoughts around resources needed to keep folks housed. I've heard a lot of things around integrated wraparound support. Is the answer more professionals? Is it more social workers, programs? I wonder if you can expand on that, perhaps, and what is the role of municipalities?
Sure. I think the answer is probably as complex as homelessness is as an issue. But yes, I would say part of the solution is more professionals. There's a Pathways to Housing program, I think, that might be a good example. Individuals live in market housing. Severe and persistent mental health conditions is a admission criteria. They live in market housing, they pay rent, they have a lease agreement, but at least once a week there are professionals that they require, whichever professionals they require. Could be psychiatrist, could be family doctor, could be occupational therapist, could be rec therapist, addiction, mental health support. Will visit them and provide them the supports that they need, and or access to counseling, and or access to other healthcare services or social services, help with their income support, whatever that might be. So that's an example of it's neither supportive housing nor just market housing, it's in between. And so I think that is an example, but it's the spectrum, not just health, but also social supports. They need a community created that will help them stay housed. Yeah, so I think it's a spectrum of supports.
Do you see a role for everyday Edmontonians in that spectrum of support?
That's a really good question, Councillor. I think, yes, I think it's everybody's role to be part of a positive community. Is there a role for City Council specifically? Insofar as your role is to help support near market and or affordable housing, yes, because individuals in these situations are often living on fixed income, they're living on income support, they're living on assured income for severely handicapped, which isn't a lot. And I know that's a provincial thing, for us to advocate for additional funds there, but I mean, with the state that we're at, City Council, I think, does have a role there to help with supporting, building and maintaining of those types of housing, all options. Yeah.
I mean, quite frankly, that's not a responsibility we typically had until recent years, that we had to take that on because it's been downloaded.
Yeah.
Appreciate that. I'll come back. Thank you.
Okay.
Thank you. Councillor Jens.
Thank you so much. And my first question is for guest Smith. I was interested, you said frostbite requiring surgery. Could you elaborate what that means?
Well, frostbite, it's a severe burn, essentially, when you think about it. And so sometimes they require surgery to be debrided. Sometimes they need amputations because it's such a severe case. So,
sorry, what does debrided mean?
Because there's dead skin that's been, like if you think about what your skin looks like when you burn it on the stove and it peels and, needs to be cleaned as a really severe burn, it's very similar with frostbite. So you might need surgical debridement of that depending on how bad the case is. So debridement is like removal of the dead skin.
Are amputations or debridement, are those day surgeries, or do they require?
Well, that depends. So for an individual who's homeless, and this is why we talk about medical respite. So an individual who's homeless, so for you, that might be a day surgery because you can be easily discharged back to your home and have someone care for you and have home care come do dressings. For someone who's homeless, where are we discharging them to? So that's another acute care, I guess, question.
One
Maybe
question.
that Celine or Dr. Sikora could ask.
Yeah, no, and I can follow it up offline. One thing I hear about from like frontline folks is about the -20 threshold we have as a city. That I believe that's kind of our date. But with wind chill, with wetness. I mean, I'd rather be -20 dry than -5 damp.
100%.
So I was wondering if you could you speak about that? About
Sure.
just how because our winter, I don't know, climates are changing, feels different. Are our policies keeping step with our weather?
That's a actually really good question. It's a good point that you make, because yes, -20, obviously you don't want to be outside in that, but what actually makes frostbite more prevalent is the warm and the wet, and then all of my clothes and my sleeping bag and my mitts and my boots and my socks and everything is wet, and then it gets cold again. And now I'm cold and wet, and that is a perfect storm for frostbite to develop. So yes, the extreme cold weather condition policies are really important, but and that's why I mentioned we also need safe, warm places for people to go, even when it's not -20. When it's wet and -5, and then it gets cold, that's actually worse.
Are there places like through Radius or others, like if I'm outside and I'm sleeping in a sleeping bag and my sleeping bag's wet, is there a place to dry it out?
Not, unfortunately, in our organization doesn't have those resources. But again, if we had laundry facilities where individuals could go, they could go launder their sleeping bag or dry it, right? As an example.
I was interested in, you spoke also about the need for more treatment. Do you know what the wait time is for a treatment bed?
I don't know what the wait time is, but what we hear from our partners that are operating detox and from our patients that are trying to access, because of some of this is access and some of it is the model of service as well. They're turning away, they might have 3 beds on a given morning and they've got 30 people lined up. So they have to triage those 30 people, and 27 people don't get a bed that day. And we hear that from our clients as well, that, today's the day I decide I want to enter detox, but there's nowhere for me to go. Everybody's full.
And then is there like a wait list, or how does that work?
No, it's just they have to keep coming back day after day. Yeah. In most systems, yeah.
And it's just a day-long process? Like, I imagine if I was addicted to substance that I would be going to some facility and I would probably be there for 30 days or something.
You come in in the morning, and if you're admitted that day, it's several days of detox and then waiting for a treatment bed after that.
And then you're clean, you're now treated, and then what? Are you discharged back to the street? Is there what's the off-ramp from treatment?
That's a great question. We don't operate treatment facilities.
Oh, okay.
So
I'll say this for our other guests then. Okay, if I can jump to guest Austin for a moment. So, you spoke about being trapped in the sort of the cycle of getting a call then going to the hospital. Is there no smooth handoff from a paramedic to hospital staff?
No, and that's part of the EMS. That's the main issue with the EMS crisis we're seeing right now in our province is with any patient, we get that patient, we go to the hospital, we give somebody a quick report, and you wait there until they have a bed available in the ER or wherever they need to go in order to hand off patient care. And you can sometimes consolidate with another crew to get an ambulance back on the street. But that's not always the case, and it ties up our crews at hospitals for hours on end sometimes.
Thank you so much. I'm out of time.
Thank you. Councillor Wright.
Thank you. Ms. Smith, thank you again for your presentation. I'm just wondering, you talk about, and I think the other speakers as well talked about stabilization that can come from housing. So how stable is it once somebody does, I think is your pathway to housing? Is that the program that you operate?
Well, we have pathways to housing, but we also have pregnancy pathways. Okay. So I'm not sure which one you're referring to.
Yeah, so the pathways to housing then. I guess how successful is it that people stay housed?
It's actually a very successful program. We have almost 70 clients right now on our caseload, and most of those clients have been on caseload for many, many years. Typically individuals that don't remain stable or never stabilize enough to stay housed are in need of actually higher level of supportive housing. So they might actually need permanent supportive housing, and so then it's a wait list situation for them. But the majority of our clients, once they're admitted to the program and are, those supports are surrounding them, they do stabilize and stay housed.
Okay, that's excellent news. And that's with that support, with those mental health supports, the occupational therapists you'd mentioned. And what sort of pressures, I guess, or have you faced any pressures in getting those human resources to help support?
That program is fortunately funded fully by Homeward Trust. So we typically have the supports, and the challenge in that regard is not necessarily access to the funding, but it's access to the human resources. Because we're a nonprofit, our salaries are lower than some private and or government level positions that are similar, and so that sometimes we have difficulty attracting staff as a result of that. But when we're fully staffed, we're also fully funded.
Are you fully staffed right now?
We are actually.
That's some great positive news coming out of that then. Awesome. And then I guess, can I ask Dr. Sikora, or do we wait till for administration presentation? Okay. Mr. LaFortune, you talked about enforcement not being part of community well-being. Can you maybe expand on that for me, please?
Sure. My intention was to communicate, and I apologize if I misspoke. I was feeling a little bit excited this morning, was that enforcement is an important part of community well-being, but there is an overly emphasized conversation right now about enforcement when you look at public transit. And so I think that when we're talking about public health today and wraparound supports and services, that when we see announcement after announcement of investments in enforcement in our downtown and our LRT, without a tantamount or corresponding conversation about upstream public health and individual health when it comes to housing and wraparound supports, people are starting to ask some pretty interesting questions in the communities that I run around in. Where's the province? Why aren't we talking as a city about where the province is when it comes to those investments? How many police are enough in our LRT stations? When will we feel safe? If our police budget is at its highest amount that it's ever been, and it keeps going up and up, why aren't the results changing? So community well-being is certainly part of the conversation, with enforcement, but it's not the only conversation we need to be having.
So you're advocating more for investment in those wraparound services, in investment for housing. Is that right?
Yeah, and I just add very quickly, Councillor Wright, also a real sense of what advocacy is actually happening to the province right now. I hear these talking points from administration, and I don't see any results.
And what do you mean talking points from administration?
When we come to council or committee meetings, we hear that advocacy is ongoing through the task force.
Okay.
What's coming out the other end?
Okay, thank you very much. My time is up.
Thank you. Councillor Stevenson.
Yes, thank you so much. I'll turn my questions to Ms. Smith as well. And thank you so much for being here and for the work that you do in our community every day. It's really, really incredible. And yeah, I appreciate the insights you've shared as well. I appreciated you highlighting the challenges of diagnosis when there's the ongoing trauma of homelessness. And I was wondering, do your patients typically stay with you as a clinic after they've been housed? And and if so, what sort of differences do you see in the medical care you're able to provide to them?
Yes. Because our primary focus is primary health care, the intention for us is to panel those individuals and have them be, our patients long-term, should they choose. Obviously, that's their choice. What we do see with our patients is most of our patients have had very long relationships with our providers at our clinic, and because part of our work is to help them get housing, and then stabilize in their health conditions once they're housed. We do have some housed patients for sure, and they do stay with us. And what we see is generally stabilization of all of their health conditions, whatever they might be, whether that's addictions or a chronic illness, it could be diabetes, could be their mental illness, whatever that might be, is that once they're housed, that is one less thing that they're worrying about day to day. Where am I sleeping? Where am I getting my next meal? You know, because those supports that are in place for us, they can still come to our clinic, and many do that are housed. They'll come to our clinic daily for, you know, if it's an injection that they need, they'll come see the nurses. If they need wound care, they can come to our clinic. They see the psychologists and psychiatrists right at our clinic. If they're still using, they come to the clinic to use the supervised consumption site. That still happens even when they're housed. So we just generally see stabilization of their life in general, including their health conditions. Yeah.
Great, thank you. And I was really interested. I know you've shared in the past just that ratio of people wanting detox and the availability of spaces. And you mentioned sort of access versus the model of service as well. I was wondering if you could just elaborate on that a little bit in terms of, you know, what sort of scaling that system up looks like, and if it's just a matter of scaling it up, or if some of that model of service needs to be considered as well.
Sure. I should also be clear that we don't operate detox, and so I'm just speaking from experience of what we're hearing from our clients and from our partners as well. So, you know, I'm sure there's rationale behind their model of service, as do we have rationale for our model of service. But what we hear is as I've said, is you know, people have to go day after day after day, and when you're in active addiction, that decision to go to detox is a really difficult one. That decision to quit, or try to at least, and get support to do it, because most people can't quit cold turkey, especially for the types of addictions that we're talking about. It's actually dangerous if they're not medically supported, for them to try and detox alone. And so, you know, I think the idea of lining up day after day to try and get access, and then being told, come back again tomorrow, day after day, is just continuing to demoralize them in their process and their desire to try and get clean and to recover. So I think, you know, that's a challenge. And what does that need to look like? You know, I don't know. I haven't examined it from the operator's perspective of how we could do things differently to improve access.
Yeah, no, that's interesting. That I think I've heard an idea recently about sort of pre-detox places where people can at least be prior to a bed opening up. So that really resonates in terms of what you've shared. Thank you. Maybe just finally, I know you've touched on some of the things, but again, just wondering how the city can best support your work. So I'm hearing, you know, the importance of the public washrooms, making those permanent. You know, other hygiene facilities around laundry, anything else that the city, any barriers that the city creates for your work, or anything that we can do to further promote it?
That's a great question. I haven't really thought about it from that perspective, if there's barriers that the city's creating.
Unintentionally, I'm sure, but
yeah, oh, for sure. You know, I think like some of the initiatives that we're working on, we really do try and tap into our city partners. Medical respite is an example. You know, we're still looking for space, an appropriate space to operate that. So, you know, been reaching out to all of my city contacts. Is there any city-owned spaces that you'd be interested in, you know, letting us use for this purpose? Because it really does help the community. So it's those types of things. And it's not so much city officials it's more city staff that we're reaching out to. Been excellent in trying to help us. So other than that, I can't really think of anything.
Well, that's great, and never hesitate to reach out, of course. But thank you again for being here today.
Great, thank you. Councillor Salvador.
Yeah, thank you so much, and thank you to all of our guests for being here today. I'm also going to direct my questions to Ms. Smith. Really appreciate everything you've shared so far, and I just wanted to pick up on a few things. One of the ongoing challenges that I've heard from family members of folks who are experiencing homelessness, or directly from unhoused community members themselves, and of course you mentioned this, is system coordination and navigation as a major gap. And I'm wondering if you can elaborate on who is responsible for system navigation. I mean, does that onus for navigating this really complex system fall to the individual who is seeking support?
Most of the time, yes. So there's lots of pieces in our system, healthcare system specifically is what I'm talking about. And the majority of the time it's up to the individual to navigate that. You know, and I say that, you know, or if you see your primary care physician and they refer you to, you know, a specialist for something, that's also helping you navigate the system. It's giving you access to another piece of the system. But for someone who's homeless, even that is overwhelming. So how do I get there? And where do I go? And are they gonna judge me when I get there? The stigma attached to being homeless and, you know, often how people appear when they're homeless creates barriers for them. But typically it is up to the individual to navigate the system, and you know, who's it up to help people navigate the system? Well, it's up to the community. So if you look at all of the community organizations that are set up, a lot of the work that is done by those community organizations is helping them navigate different aspects of the system, whether it's connecting to community and social services for income support or helping to connect to Alberta Health Services for services that are, you know, needed in the acute care system, or other healthcare types of needs. So it's the community that really steps up and help. And there's also, you know, as Ms. Tash mentioned as well, there's social workers in the acute care system, but once you're out of the acute care system, that's not necessarily part of their role anymore, right? So they've provided you that support while you're in the acute care system, and then if you're on the street, there really isn't anyone, right? Primary care physicians' offices aren't set up to do that navigation, but that's part of the, you know, the model of our service is a community health center is intended to do that. We provide those wraparound supports, we provide access to all of those. Actually, we provide a lot of the services ourselves so that access is a lot easier.
Yeah, well, I appreciate you elaborating on that, and I mean, I think it highlights the really integral work that you're doing, and that community organizations and agencies are doing. And then maybe just as sort of a concrete example, one thing that I've heard over and over, something as simple as a lack of ID can prevent folks from accessing the supports they need. Any suggestions on how we can overcome this, you know, seemingly simple barrier in our community?
Such a great question. So part of the challenge is people not having ID, and then the process for them to get ID and then get Alberta Health card on top of that after that. You know, some of it is really individualized. There's individuals who don't know a lot about their birth mother, maybe don't even know her name. And so if you don't have a birth certificate or any other ID and you don't know anything about your birth parents, it's a really long process to try and get identification. You know, how do we fix that? I think if we had ideas about how to fix it, we would have fixed it already. But I think the community steps up. And so the community has social workers and other client support type workers that will help individuals navigate that system to try and get the ID that they need. Then the challenge is them keeping it. So if you're homeless, where do you put your stuff? Right? Your stuff gets stolen, now my ID is stolen, I got to start the process all over again. So it is a bit of a symptom and a process. I guess, yeah. I don't know if I've really answered your question.
Yeah,
but
no, that's
it's complex, I guess, is how I should have just said.
Yeah. No, absolutely. That is helpful, and I'll direct some of these questions to HS as well, and I'll yield the rest of my time. Thank you.
Great, thank you. Starting the second round then, Councillor Jantz.
Thank you, and I was hoping we could go back to just a comment you had made about responding to overdoses. Do you track data on that?
We do. Every overdose that occurs in our supervised consumption site, of course, is charted in our electronic medical record, and then any of our overdoses that we respond to outside on our property or that our community response team, funded by the city, thank you very much, is also charted in our electronic medical record system. I don't have the data with me in front of me to give you numbers, but we do track it, yes.
I was talking to someone who said one thing we aren't tracking, and maybe we are, is somebody has an overdose. Their brain is without oxygen for, it could be a number of minutes. Then they're brought back. That we know causes brain damage. And for some people, they've had multiple minutes cumulatively without oxygen to their brain, and that's causing compounding brain damage. And then that causes behavioral and all sorts of other hardships. And do you track that?
That's really hard to suss out. So, I think it's not something that we probably assess. We would certainly track the number of overdoses for an individual if they've given us their PHN, because of course supervised consumption can be anonymous if they so choose. So if they have an overdose, if we know who they are, we can add that to their chart. But if they've asked for all of their visits to be anonymous, then we can't necessarily link that to their health assessment broadly if they're a patient of our organization. So that's really hard to track unless they've given us permission to have all of their health data together. In addition to the fact it's really hard to assess that cumulative effect. Now, if they've been a patient of ours for a long period of time, we might be able to say over, 5-10 years of their substance use disorder, we've seen a steady decline in their cognitive capacity through testing, because we do actually have the ability to do cognitive testing as well. So, you might be able to assess that, absolutely. But is it something we do routinely? Not necessarily.
Do you offer safe supply?
Safe supply?
Safe supply of drugs?
No.
No. Do you offer opiate substitutes? Or if somebody's trying to go on...
So opioid agonist therapy, you mean? Yes. So we have, our clinic is, about half of our physicians actually are certified in addictions medicine. And so and many of our others are working towards, or many of others providers are working towards that. So they do actually offer opioid agonist therapy, yes.
I represent the south side of the city. There is another organization that's interested in opening a health hub, and it may also include safe consumption. I believe there's an overdose prevention site included, very small, three beds, 3 desks, if you will. Some are concerned that this will bring crime and social disorder and other pieces like that. Would you, in your experience with your site, do you think there's merit to that? Is there heightened crime and social disorder from your site, or how would you respond to some of the people who are worried about a health hub opening in their neighborhood?
I think education is really important to understand that the individuals are there and need the service, and the reason that the site is being set up or proposed to be set up where it's set up is because there's been shown to be emergency calls for overdoses and poisonings in the area, and so it's happening in the area. And so we're trying to put supports, not we, collective we, are trying to put supports where the supports are needed. Do we see crime and disorder in our community? Of course we do, but that was happening long before we had a supervised consumption site. Our supervised consumption site's only been operating since 2018. We've been operating since 1980. So, there's been disorder in that community long since before that. I would say the supervised consumption site provides a space for people to go to not only engage, get safe supplies, but also be in a safer, because consumption is not safe. We know that. That's why we say supervised consumption site, not safe consumption site, because it's not safe. But having that service there provides a space for people to go so they're not using in the back alley, provides a space for them to dispose of their needles or other paraphernalia that they're using if they're not injecting. Yeah.
That's very helpful. Thank you.
Mm-hmm.
Thank you. Councillor Tang.
Thank you. Just a couple, or maybe one, couple questions for, first I'll start with Bradley. I agree with you that, to me, I think today's presentation and the discussion has been quite refreshing, because over the past year or so, there's been a disproportionate emphasis around houselessness and poverty as a public safety issue rather than public health issue. And you talk about this point around true partnership, that you don't see it happening despite repeated advocacy and various speaking points raised. And I don't disagree with you on there either. Sometimes it can be very difficult. I'm just wondering if you can expand on that. So do we keep, is the answer to keep at it? Where else should we look?
Thanks, Councillor Tang. I think that, first of all, I'll say I think you all are doing a wonderful job in your advocacy roles to other orders of government. So I really don't want to communicate that, the efforts are not happening. I think that we need to keep at it. I believe that we need to also tell our story, our city's story, from a different frame, that we are a caring city, that we know that these supports and services are needed, as we're hearing today, whether it's health hubs or other supports and services and systems navigation, and that if we don't invest in these upstream solutions, that our only solution will be more and more investment in enforcement. And that's simply not working. And I think that we need to hear it more loudly and more clearly from council with a united voice, that we need a partner in the province. And currently we don't have that. And I know that that's very black and white. And, I tend to be that way in my role. And maybe there's a more nuanced language than that, but I don't see our current strategies bearing fruit right now. And we're about to see a budget, dropped on February 28th from the province. I know that we submitted our wish list. But, if, the past is prologue, if you will, I'm not hopeful. And so I think we need to keep at it. We need to dig in, and we also need to use our partners, our willing partners, to make the case that we need a different approach and we need more investment in these kinds of supports and services that we're hearing about today.
Great, thank you. And maybe just the last one to Aaron. Did I hear you say you also, have a lot of, context from colleagues across the province? I think I heard you say Peace River. Is that right? Are you still there? Oh, no.
Sorry, you'd said Aaron, but
yeah. Oh, sorry, Austin.
I am
Austin,
from,
my
Peace
bad.
River. I wasn't sure if it was directed to me or not.
Yeah, Austin. Sorry, that was for you. Just you have mentioned that you do see quite a wide scope of various things across the province, and I don't know if you mentioned Peace River or if I heard that wrong.
Yeah, so I'm actually I work full time in Peace River. Through our union and through the various things I do through our union, I'm well aware and well versed in kind of EMS across the province. Just through, it's a small world, just through talking to different people. And we definitely do see different issues, rural versus metro, but.
Yeah, and I guess where I'm going with this is what you see in smaller municipalities, towns, villages, counties. How do how do they compare to the issues found in big cities?
I would say so I work full time here in Peace River. There's a lot less resources available to our clients here. There's one homeless shelter that is available for all the north. I believe it's the only. I don't know if High Level has one, which is about 3-hour drive north of Peace River. And this one shelter deals with every homeless, helpless person in the north, and they don't have the resources to help them all the time. We often just see them discharged back to the shelter, and it's a continuing cycle.
Yeah, and I imagine that also adds pressure to the big city as well. Anyways, thank you very much for being here. Thank you all for speaking.
Councillor Rutherford, still in the first round.
Thank you, Mr. Chair. Can everybody hear me okay? Okay, great.
Yep.
I'm going to go to Ms. Smith. One thing that you said that really struck me, and I've been processing it and mulling it over through this dialogue and conversation, is, once somebody is homeless, how hard it is to get housed. And I know the stats that show, for every month that somebody is homeless, how much harder it is to get housed. And it's a lot to do with the health factors that the chief medical officer highlighted. So I've been advocating a lot around housing breakdown prevention. And I'm wondering if you have any thoughts on that, because we focus a lot on kind of housing folks once they're unhoused. But I feel like a missing link in this conversation, especially when we're talking about saving costs in both the healthcare and the and the justice system, would be housing breakdown prevention. What are your thoughts on that?
I agree with you 110%. Getting people housed is a lot of work. There's a lot of resources going into finding people housing once they're homeless. But I think we need to do a better job of individualized support plans for individuals to help them stay housed. And you know, as I mentioned, I think through I think it was Councillor Tang's question, is that comes and in a variety of ways. That could be health supports, that could be mental health supports, it could be social supports, whatever it might be. But I think we need to think about what the individual needs are. We create systems that we think, and then try and fit people into those systems instead of trying to find out what individuals need and create services that meet that individual's needs. And I know that's harder at the outset, but I think in the long run we'll end up saving money because the individual has what they need, and those needs can change and the supports can change along with their needs over time. There's ebbs and flows, and they might be stable, you know, 1 minute and then, you know, destabilize. And so how do we provide those supports? I think that's a question we really need to look at and really need to examine. And we do it through some of our programs, as I'd already mentioned. There are some unique programs out there that are working really well. We just need to do more of it.
Okay, thank you. And to Mr. Lafortune, one of the other things that I've talked about a lot with my council colleagues, so nobody will be surprised about what I'm about to say, is I'm concerned about our housing strategy being based on 80% below market. We have our housing strategy report coming back with the next 4-year strategy based on the funding that we provided at budget. Any insights or thoughts on that from your perspective?
Yes, thank you, Councillor Rutherford. And I've seen you bringing that up more and more. And I want to thank you for putting that into the conversation about affordable, adequate housing. I think it's absolutely critical. One of the tables that we sit at, the National Right to Housing Network, is talking about that very thing at the national level as well. And that we need very clear, established, and uniform definitions of affordability. And I think 80% below market is inadequate. I agree with you. I don't know, you know, I don't know. I don't know what the answer is, but I think that we need to be part of that national conversation and advocating for something that is a true definition of affordability in our communities, especially when we've seen year over year in Alberta rents increase anywhere between, you know, somewhere like 10 to 20% depending on community. Mm-hmm. And even, you know, it's relatively affordable place, but it's becoming less so. And so when we're thinking about security of tenure, as you're bringing up, we really need to think about affordability in an honest way. Thank you.
Okay, thank you. Those are all my questions, Mr. Chair. Thank you for the time.
Thank you. Councillor Wright.
Thank you. Just a couple more questions, Ms. Smith. When Councillor Salvador was talking about who's responsible for navigating the system and that, if someone's on like AISH or some other provincial support program or whatever, do they not have caseworkers that help them navigate?
So I actually used to work in community and social services. I was the executive director for Edmonton region for income support and AISH programs. Okay. So I share that only as, you know, I do have experience in the system, not just experience with clients who are accessing the system. The caseloads of the AISH workers in provincial levels is far too high for them to actually be truly supportive in terms of navigating the system. Is the system set up and intended to provide that type of support? Yes. But I would also say that many individuals are so complex that The role of the AISH caseworker is more to ensure that they have the proper income levels, the proper additional supports, supplemental benefits and stuff added to their system based on their health conditions and other factors, versus helping them actually, connecting with a landlord if there's a problem, because that's often what support happens, or finding them a ride or giving them a ride to appointments. It's more of the financial aspect of the support, because their caseloads are just too high to be able to do more, frankly.
What would be a manageable caseload?
Well, and I think that it's based on complexity. So I wouldn't be able to attach a number to it. And actually there is a system for them to actually score the complexity of their clients so that they have balanced caseloads across as well. And I know I'm really getting into weeds and details, but I think it's just important to recognize that it's not a numbers game. It's about complexity of individuals as well, because some of them are more complex than others.
So if that support was there and available, that would take some of the pressure off of
the community
organizations like yours. And okay. And then what about, so you're in the downtown area?
Correct, yeah.
And you'd mentioned, wanting to know if there's any city resources available as far as where to sort of set up shop, I guess. Would you recommend maybe expanding your services across the city, or similar organizations set up across the city?
Yes. Yes, 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 yes. If we had funding and space, again, as a nonprofit, some of our funding does come from Alberta Health Services to be able to support the work that we do, but a lot of the work that we do is funded through foundations and grants and other things. Well, we have a grant with the city to do our community response team, for example, but if we had space and funding to be able to expand, yeah, absolutely. Absolutely, we could.
And that would
and should
help address concerns.
It would improve
absolutely
would improve access to those integrated supports, as I'd mentioned, which is really critical for this population. Yep.
All right, thank you very much. That's all I have.
Thank you. I think that completes questions we have of our speakers today. Just wait and look at the various communication modes here to see if anybody else pops on. I'm not seeing any, so thank you very much for coming down and for participating today. And for those online, thank you for your submissions and for taking our questions. We really appreciate your input and your participation in this conversation. We'll invite our delegation back up then, and we'll go to questions of our delegation. Very good. So we will start with Councillor Tang. Please go ahead.
Great. Thank you very much for the presentation and the discussion. I was wondering if you can kind of comment on this. I mean, from what I see, a disconnect between the public health and public safety issue that has been hugely emphasized in this past year. Is there a disconnect? Are we talking about homelessness as a health issue enough? Or is it a crime and disorder issue? Because I feel I hear the latter overwhelmingly in the news, in government announcements, on the solutions presented. I think we heard our speakers comment on that. So I guess I'm just wondering if you can comment on that.
Councillor Tang, thank you very much for the question. I think it's absolutely a fair question. Difficult to comment on that. I think a lot of the response approaches that have been discussed and have been in the consciousness around our city are based in both ends of those. And I think it's important to acknowledge that there has to be a coordinated approach between any of that. Being able to highlight the health benefits of being housed, being able to highlight the importance of having a multifactorial approach that prevents people from being homeless in the first place, matching resources to what's needed for an individual. Once housed, being able to prevent individuals from relapsing into homelessness, being able to integrate the medical and health supports along that spectrum of care there's always room for improvement in those, in that type of a discussion. Social disorder is a component within that. I think we all certainly appreciate a want and a need to have a safe community, safe spaces, and thriving cities. So I think being able to address all of that along the respective spectrums is something that's going to be important to be able to do.
Thank you for that commentary. The other thing I was wondering too, about spending. Health is the largest portion of our provincial budget. I can't remember the exact figures. Healthcare system make up a vast majority of that. We have some of the highest health spending per capita in the country. I imagine if you look at the spending for those without fixed address and compounded with social service and justice spending, it's even more. Are we not spending enough? When we talk about resource and the lack of resource, I'm hearing that a lot. Where's the gap?
So we are the contingent of public and population and public health. And so we would say that if we are really going to change the trajectory of health for the population, that there needs to be that whole view of health from the social determinants of health point of view. Pardon me. We know that access to health care is about 25% of a contributor to overall health status. We know that all of the other things, poverty, education, homelessness, houselessness, all the other social pieces actually make up a greater component of health status. And so absolutely, we need to be thinking about how we invest money to actually address the social determinants of health, and not just about access to a healthcare system that this population has difficulty accessing.
Yeah, and I think we always say public health is a poor cousin of acute care. And I think that's a timeless question, right? It's always been around, and I think we haven't really shifted that kind of pendulum in any significant way, even prior to the pandemic. And anyways.
So, Councillor, I think it does highlight the need for those upstream investments, and those upstream investments aren't necessarily within our healthcare infrastructure. What we commit from a healthcare approach is system integration. We want to and have to be collaborative in approaches, but those investments often are in things that the healthcare system doesn't do. We don't do housing. Yeah. We don't do income supports. We don't do education. We don't do policing. But we're the beneficiary of good collaborative community-based work that is undertaken in any of those respective environments.
And really want to thank you for that partnership. Thank you.
Thank you. Councillor Jans.
Thank you. I was wondering, and I believe I sent my questions in advance through administration, which I believe were provided to you, so I hope this is interpreted in good faith. I was wondering about what the status is of the AHS Edmonton IOAT program, how many patients are still enrolled, how many deaths have occurred against patients since the program started transitioning people to only the oral medications. Do we track that?
I think it's a fair question. Thank you very much, Councillor Jans. So the IOAT program has transitioned to the narcotic transition service, if I remember right. It's an approach that we're trying best to match services for patients themselves. The deaths from narcotics and death from opiate poisonings is something that Alberta Health does track and does post publicly on the Alberta Health opiate dashboard. So that's generally accepted as the source of truth around those. Tracking patient outcomes is something that any of our clinical services do overall. I think in terms of the NTS, it's likely too new in terms of being able to identify what those outcomes are.
How many patients are still enrolled?
I don't have specific numbers on that, I'm sorry.
Who would?
We do have a mental health service and an addictions mental health team that I think would be very, very much willing to be able to have a conversation with administration around what the current update is, or what the current status is of all of the mental health services within the Edmonton zone. And I think that's probably a better venue for someone more expert than me from a mental health perspective would be better suited to be able to provide a lot of those responses, Councillor.
So on the narcotics transition service, how many spots are available in Edmonton?
I don't have those specific numbers. Actually, I believe it's somewhere around 24 overall, and people may come in and out of that service over time. But again, it's an evolving service that AHS is involved with.
How many recovery beds are available to Edmontonians?
So I know we have a.
Maybe first question: yeah. What is how do you define a recovery site?
So we did have a number of detox sites overall. So we have Alberta Recovery Services that's well subscribed. It's based at Alberta Hospital, Edmonton. It's actively subscribed. It's often full with wait lists with waiting as described by Ms. Smith. That's again, being able to match services for clients is something that our addictions mental health services is striving to do.
How many spaces are?
I believe there's 42 there, and there might be a further handful in the community overall.
All right. So if we have 42 there and maybe a few more, but we have about 3,000 unhoused people struggling with many are struggling with some form of addiction. We're way behind.
Matching to the individual needs is something that the mental health services strives to do. So not everybody needs that particular service. It might require or might benefit most from an outpatient. What it does, I think a conclusion of this is we have gaps in coverage, we have gaps in primary care access, we have stresses within our EMS system, we have stresses within our emergency department infrastructure as well as inpatient. Those stressors are resulting in delays in treatment, prolonged admissions, and those are things that we want to be able to improve overall.
So if I was to say we have 3,000 unhoused people, therefore City Council write a letter to advocate for 3,000 recovery spaces, would you say is that the right way to think about this, or?
It's a way that's possible. Being able to have services matched to the individual health needs, I think, is something that would be helpful or that is beneficial for the individual and for the community overall. Not everyone needs a detox space, but for some that might be a very appropriate service.
What are the alternatives available?
Again, I'm not a mental health specialist in that environment. I think if there's a further in-depth discussion around that, we could provide an individual from the mental health service to be able to have more of that discussion.
Yeah, no, appreciate that. I've got a few others on different topics. Thank you.
Thank you. Councillor Wright.
Thank you. I think is it Ms. Tash? Sorry. I think you spoke about having social workers in the emergency departments. Is that right? Is there enough funding coming down for that?
Well, I think we would always say there's never enough funding. It's not about funding. I think it's about how we do our business. And I think that they've invested a lot into different settings, including emerge departments, acute care, inpatient units, to provide that support to those that actually are going to need some support when they are discharged. One of the things I was remiss, and it's related to your comment, we do have an identification program. So our social workers do work to get individuals having identification, getting identification. So once they're in the health system, we can identify some of these things and help them with it. But if they don't actually make it to the health system, we can't do some of those things. Are there enough resources? Probably not enough resources to address all of the social needs. But I think there's a shift in thinking about that aspect than just the medical care.
And so while they're in the acute system, they've got access to that social worker, but once they leave it, does any of that continue?
Well, one of the things that our social workers do is they work closely with community agencies. So working on making those connections for transitional housing, or making the referrals to community agencies that would have some of those services, or making referrals to addiction and mental health. So it's trying to connect people and connect them to the community that they live in, which is really an important part.
But no further follow-up. So if someone did have some mental health issues and that maybe couldn't sort of manage on their own to...
It's not like a navigator or caseworker sort of situation.
That's what I was wondering. Okay. And then... Oh, and you'd also mentioned that there's other activities underway for youth support and mental health, but you just kind of said...
Yeah, and I didn't go into it because, like Dr. Sikora, I'm not the mental health expert, but I would strongly recommend having our contingent from addiction and mental health come. They do a variety of services that spans the continuum. You know, they have the acute care beds, but there's a whole lot of outpatient work that happens, and they work very hard to connect to our most vulnerable populations and work with the community agencies. So I'd recommend that.
Okay, thank you. And Dr. Sikora, you had, I think it was the last slide, there was the solutions. The first bullet on there was prevention. Prevention of what? Of homelessness? Of
So prevention of houselessness, homelessness.
Okay. And that would be the #1 solution to healthcare?
We have to do all of it.
Okay.
Prevention, enhancing the transition environments, and then enhancing the supportive permanent housing environments as well, because individuals will come in and out of those areas at any time. Some individuals might be at risk for homeless, but not yet homeless. We need to keep them housed.
Okay. Those on the fringe, I think, as Mr. Farrow was talking about from Peace River.
Yes.
To prevent them from becoming homeless. Okay, thank you. And in my last minute, Ms. Gelattley, do we have city resources available?
Thank you for the question, Councillor. Certainly there are city resources that we are putting into many different spaces, not only financial resources, but also time and collaboration and so on. And so what we've heard today is that the entire spectrum of housing, mental health, addiction support, and all of the social determinants of health need to be coordinated together. So we do a great amount of effort to sit on many of the same tables that we're talking about today, to work with community members to ensure that to the extent possible and with our current resources, we can connect individuals to those supports within the communities and the locations where they're at.
Okay. I'm just referring back to Ms. Smith, looking for, I think it was like facility resources.
Yeah, so we've been in conversations, in-depth conversations with them about a number of different options. So we continue those to identify what the right solution might be.
Okay, thank you very much. That's all I have.
Thank you. Councillor Knack.
Thank you, Councillor Cartmel. Thank you so much for this presentation. I had a few questions about the slide that was dealt with inpatient admissions and inpatient length of stay. I might have missed it, and if I did, my apologies, but I was just curious, when was this data from? This looks very similar to the Ambrose Place data, but I don't know if that's from that or if this is more current.
The before-after was a 2-year study of individuals that were housed in the Ambrose Place housing location.
Perfect. So this is the Ambrose Place study. So maybe then the follow-up question, recognizing that, unfortunately, we haven't really had many more Ambrose Places opened, although we're getting to that point where I think 453 are coming on board. Is it fair to assume that this data would still likely translate to the new 24/7 supportive housing units we're opening up? Is there anything to suggest this would have changed?
I don't believe there's anything to suggest that it wouldn't apply. Those reductions in acute care resources were somewhat profound. I think there would be an understanding that we would expect to see a similar decrease in utilization from those individuals that would be housed in a supportive environment where their really health and individual needs are being adequately met.
Great, that's helpful. That study, when that was done, also showed, and I just want to confirm that I still have the accurate numbers, that the total savings to the healthcare system was $10,441 per resident. Does that sound familiar? Is that?
Off the top of my head, I don't recall the dollar amount.
Maybe I'll ask it more generally then, just that is it safe to assume that with results like the one you've shown in the slide and what we've seen in Ambrose Place, that it is very likely there is a net savings for somebody to have housing versus being in an emergency room bed, X number of years?
I think there is a net savings to the healthcare infrastructure around an individual being stably housed and having their needs met in a supportive environment, yes.
Okay, that's helpful. Really appreciate that. Maybe the only other question is, while I've had this data, and I'm glad to have it in the slide, I actually don't know where that study is publicly accessible. Is that on the AHS website? Is that something that can be put publicly or shared with the city so we can put it on our supportive housing website? Because we've talked about it over the years in committee meetings, but I don't actually have a study I can just hand to a resident so that they can see it firsthand.
That's a great question. I'm going to have to take that one away, Councillor Knack.
Sure. No, that's perfect. And then to administration, is that something you can also work on with Dr. Sikora? Because I think we should have that on our supportive housing website so that people can see directly just most importantly, how people get better health outcomes, but also how much is saved when investment in supportive housing is made.
Of course.
That's wonderful. Again, thank you so much. It's really great to have this information. Things we need to continue to drive home on this. Those are all my questions right now. Thank you, Councillor Cartmel.
Thank you. I keep hitting the wrong button. Councillor Salvador.
Yeah, thank you. Just want to actually build on some of the questions that Councillor Knack was asking, because we're really, this narrative of housing as a form of healthcare is coming through really strong, and I'm wondering, is that narrative starting to shift? Are people starting to realize that housing absolutely is part of our healthcare system? And on the funding side, I guess, is housing funded in a way that reflects its role in the healthcare system?
I think it's in the public health circles, it's always been acknowledged that housing is a critical aspect of health. It's one of the core determinants. For my professional lifetime, we've always had the perspective that housing first approach is something that's certainly beneficial, and that engaging in health care services around chronic disease, it can only be done when an individual is willing to participate in those discussions. Often chaos and unstable housing doesn't enable individuals to be able to engage fully in their care around things related possibly to mental health, around chronic disease, around other health conditions. So I think the conversation is starting to shift a little bit. Certainly, housing first approaches have been adopted around the world. Throughout Canada, we've had a housing first approach here in Edmonton for a number of years. I do see an evolution of trying to better match specific housing resources and supports for individuals as things present. If an individual needs more resource at a particular point in time after being housed, there seems to be a better ability. We have the consolidation of Homeward Trust as an entity. We have data that's starting to support better some of those decision making. Housing funding itself is not within the healthcare infrastructure, and the partnerships that are required between multiple levels of government, around federal, around municipal, around provincial, are evident, certainly. And I think there appears to be much more and more willingness to have the conversations and discussions around housing is critical. Housing is something that prevents health outcomes later on. and that multiple environments, multiple partners are needed to be able to come together to support an individual, and that individual might need flexible support over the foreseeable future. So I think it's starting to change.
Yeah, okay, well that's helpful. Yeah, and I also just really appreciate Councillor Knack's line of questioning that makes it very clear that housing folks is not just the right thing to do, but it's the economic thing to do as well, thinking of the savings to the overall system. So maybe just want to ask some questions around, how to further prevent the discharging of folks back into homelessness. And I know you mentioned the Bridge Healing Project, which, I think is a really good step. But at this point, my understanding is it's a relatively small pilot. What is the current plan for discharging when folks are completed treatment?
Many individuals are discharged into their current state, and if that happens to be a homeless state, then that is how they're discharged. Many of the community organizations do provide some of that stopgap support, and the expert care at Radius Health does phenomenal work around our inner city population, as do many of the shelter environments. Being able to link to other health services that weren't necessarily associated with that inpatient admission or that specific emergency department visit might be related to chronic disease, might be related to mental health conditions, might be related to addictions, might be related to wound care. It does present and highlight a gap in access to primary care, access to other social supports that's present not just within our inner city, but throughout the city of Edmonton proper.
Yeah, absolutely. And sort of, again, that recurring cost, because if folks are being discharged and showing up, just a few days later, the cost incurred on the acute care system, I imagine, is substantial.
Yep.
Okay, and maybe just really quickly, how do we ensure that no door is a wrong door when folks are trying to access the system? And I'll leave it at that. Just a quick answer on that one.
I'm not sure I have a quick answer for that one, Councillor Salvador. I agree with Ms. Tash. A prototype to highlight may be our Access 24/7 around our mental health supports here in the Edmonton zone. So I think this might be a good opportunity to engage with our mental health specialists to be able to describe and any door is the right door, at least the first door should be the right one approach for at least our mental health services. And again, being able to highlight some of those access points, whether there be 811 through HealthLink, 211, 311, as access points for services that are needed at a particular point in time. But the coordination of that is significant and important.
Thank you.
Thank you. Councillor Stevenson.
Yeah, thank you so much. This has been such an important conversation, and I really appreciate the conversation we've been having around housing. And I think what really strikes me in this discussion is that it's very much a both-and proposition, right? What I'm hearing is that supports are needed. And so even though housing isn't necessarily sufficient on its own, it does certainly seem to be quite a necessary component in some of the successes that we're seeing. Is that a fair characterization?
I think that's fair.
Okay. And shifting a little bit, I guess, into thinking specifically about some of the addictions and mental health challenges that folks might be facing. My understanding is that trauma is really an underlying factor in many addictions. And for some, those traumas might be rooted in institutionalization or a lifetime of really negative interactions with the system itself. So I'm just wondering your thoughts and the thinking that's behind how we design treatment options for these individuals so that we don't reinforce the trauma through a treatment path. Is that a discussion that's ongoing at AHS right now?
I think that's a very critical observation. So trauma may be rooted in colonization, may be rooted in culture, gender, early childhood. Experiences over our lifetime will contribute to trauma overall. Interactions with healthcare, interactions with our justice system aren't always positive. And those add to increased stress and increased perhaps unwillingness to engage in activities that that could be ultimately important and helpful to the overall individual's health. We do our best to create safe spaces. We do our best to do trauma-informed care, and certainly many of our training pathways within Alberta Health Services do strive to have a trauma-informed approach. We try our best to have warm, welcoming spaces, and I'll admit that it's not always warm and welcoming, and it's very individual specific, and I can't define it I'm not the one to define if a person feels safe in a space. That's for the individual to define, and we're very much wanting to engage in those discussions around design and around service design, also geographic and physical infrastructure design.
Well, that's great, and I appreciate, maybe early days, but that journey is happening and that effort is being made. And, I'm familiar with the great partnerships that AHS has had with Niganan Housing Ventures, at Ambrose Place, and now Omamuwango Gamek, I think. Very, very exceptional examples of great collaboration. So maybe on that, you mentioned colonization. So just wondering what AHS is doing to sort of intentionally build on the knowledge and expertise of Indigenous-led organizations in this space.
So we are being very intentional around the Indigenous population, and we are actually creating an Indigenous action plan for Alberta Health Services, and it's in partnership with our Indigenous partners, of course, the First Nations, Métis, and Inuit groups. And so we know that we can't just build our healthcare system the same way to be able to address the reconciliation, the truth and reconciliation, as well as all of the trauma that's related to the institutions, and we are an institution. Hospitals are institutions. All of our buildings look like institutions. So we're working really hard at understanding that and building that together and moving forward together. We know that our Indigenous population is disproportionately sicker, less well, and we have to do better. And so AHS is very, very committed to that.
Amazing. That's so exciting to hear, and really appreciate the work you're doing in that space. Maybe just lastly, we've touched on it a few times, but I'm really, really hearing something around the idea of the system navigator, and as Councillor Salvador was saying, sort of no door being the wrong door. Is that something that has been done in the past in terms of AHS providing the system navigation resources, or is that something that needs to happen outside of AHS?
I think there are parts of the system that have system navigators. And even in ED, we have transition coordinators that really try and assist individuals to move out of the acute care system to wherever they need to be. But I think that we need to do more of that, and all of the conversations, almost every meeting we have or conversation that we have, particularly when we're talking about populations with complex needs, is the need for that system navigation. Does it need to sit in the health system? I don't know. We certainly, with our new Canadian partnership, we know that they really benefit from a multicultural health broker or system navigator. And so we are talking about that more and more because we have this very large onerous system that the best of us have trouble navigating. So
I think it does highlight the need for that system integration, but the system navigation is a part of that. Information sharing is part of that. And the ownership around how something gets done to support an individual and to support a family and support a community doesn't always have to sit in the healthcare infrastructure. If we use our multicultural health brokers, that sits outside of AHS, and they do a phenomenal job at their activity.
Well, thank you so much. I've gone well over time, but I appreciate it.
Thank you. Councillor Tang.
Great. Maybe I'll first move that the February 7th, 2023 Community Services Report CS 01627 be received for information. I don't have a ton of outstanding questions, maybe some smaller ones. You had mentioned that for gender diverse people it has been particularly challenging, especially at younger age, et cetera. Any particular resources from AHS in that, I guess, targeted population approach?
No, I think this is an area that's getting more and more attention. I think we're early in our understanding of this. We are certainly, as an organization, working to increase our literacy and awareness and our working knowledge around diverse populations and gender diverse populations, and getting better at delivering services in an inclusive way. I don't know that I can say anything more than that. What would you say, Chris?
We have a sexual orientation and gender health advisory council at a provincial level to be able to provide support to all of Alberta Health Services around these particular issues, around gender diverse individuals in our houseless, homeless. I can't think of any particular interventions that we have right now. Just we're taking things slowly, wanted to understand more and act where we take advice as where we should act.
Yeah, no, great. Good to hear that things are, continues to make strides in that. I guess, can you comment on sort of, I know you're focused on the Edmonton zone, but, in speaking to colleagues across the province, sort of trends in municipalities of varying sizes? Because part of, I think, what I'm observing is issues around homelessness and mental health and addiction isn't unique to big cities. And in fact, because of the lack of resources in a lot of the smaller places, they're, putting a lot of the pressures, whether they, the way people are being discharged, or they're flowing to the big city for treatments, et cetera, et cetera. Have you seen that trend, and of course, I think that's always happened, but have you seen that trend kind of worsen over the years, adding to some of the challenges that we're seeing on the streets?
The houselessness, homelessness isn't an Edmonton-only problem. It's something that I
That's
know is certainly faced across all of Alberta, certainly within our rural communities, within our urban communities themselves. I know from our overdose and drug poisoning data, that's something that's shared across all of our population. Our University of Alberta injury reports also point that injuries related to homelessness, houselessness are equally faced across all of our jurisdictions and all of our municipalities. And certainly that's an experience that's shared amongst any of the big cities across Canada, any of the provinces, and most certainly south of the border as well. Approaches, each municipality has a different approach based on their particular jurisdiction, with how integrated a healthcare infrastructure may be, how integrated public health response teams happen to be, relationships between multiple levels of government. Within an Alberta context, relationship between our justice environment, our education environment, our income support environment, our housing environments, Ministry of Mental Health or Health Services, as along with Alberta Health, and then the health authorities, is all very much critical to helping define and design a response that's most suited for our particular population. What will work in Edmonton will probably look very similar to what will work in Calgary, and will look very similar to what will work in St. Albert, just there will be minor nuances, making sure we have all the partners around the table to be able to have those discussions around data sharing, around system integration, around prevention and response is something that's needed.
And we are sharing data.
As much as we can.
Okay.
We do have limitations under Health Information Act.
I understand.
And those are things we all have to abide by, but as much as we're able to, we do share.
Excellent. Thank you very much. I'll speak to it when the time comes.
Yep. Thank you. Councillor Jans.
Thank you. I was wondering on page 13 of your 13 for me, the number of acute mental health hospital admissions over the last 4 fiscal years are as follows: 2018, 4,600, 2022, 2021, 22, 6,000. That's quite a jump since 2018. What do we attribute that to?
So if counting total number of admissions, it could also represent a lower length of stay, so better integration with community resources so that individuals stay in hospital a lower period of time, thereby increasing numbers. There was a pandemic in there, Councillor. We have had increased homelessness. We have seen with another one of those graphs the increase in drug poisonings and overall opiate overdoses. So multifactorial, absolutely.
How does that represent against a general number of hospital admissions? Like, do you even say, for instance, like last year, if 6,000 admissions to hospital were related to homelessness, is that about 50%? Is that?
I don't have those numbers on me, and I hesitate to speculate, Councillor Jans.
Like anecdotally, the last time I was in an emergent waiting room, it felt like it was like 3 out of 4 people there were unhoused.
Difficult to make. Yeah, I have a tough time answering that. I do know that I'll go back to one of our slides. Over that 2018 to 2020 time period, when we had a cohort of individuals that we know were utilizing and using shelter environments, we know individuals used the emergency department very often for their primary care needs. And that does speak to a broader gap to primary care, as in community-based primary care. So I think investments in those environments around specific access points that are going to be appropriate for an individual, and that an individual actually feels comfortable in accessing is going to be something that will help overall.
Yeah. I had a question about reporting of deaths. Who tracks deaths in Alberta?
In Alberta, it's the coroner's office. They're based at the Government of Alberta in Justice and Solicitor General Environment. They do the analysis, and occasionally we'll post reports. So that's outside of our healthcare realm, and so I wasn't able to provide a fulsome response in those questions, Councillor.
So if I have questions about the number of deaths to people with no fixed address, I would need to direct those to the coroner?
That is correct. The last time the coroner had a report on homelessness was, I believe, 2013-14.
10 years ago?
Yes.
Oh, really? Oh, okay. Maybe that's definitely a subsequent action. Thank you. I was interested in pregnancy care. We heard earlier about certainly people who are unhoused still have intimacy, and how is that? How does the system cope?
So we depend on community partners to identify individuals, but we do have a community perinatal program, which is to support those women who are pregnant that don't have a primary care physician. We can connect them to a primary care physician within our community perinatal program, provide appropriate prenatal care, and then postnatal care so that we have better health outcomes. We also have a Health for Two program within our public health centers. And again, it's focused on individuals who are suffering from social determinants of health, elements to their life, and we can provide some nutritional supports and those sorts of things. Again, I think one of the gaps that I keep thinking about is if they can access the services. We have some services, and it's the gap where how do we reach the individuals that aren't accessing the services? And so we depend on our community agencies for referrals. We depend on multicultural health brokers that are in the communities, and they deliver some of the some of the prenatal and postnatal care. But we do have these services, but it's only if they can connect to us somehow. And so it is a gap that we continue to think about. How do we reach the people that we're not reaching?
So of the 20% who are youth who are unhoused, does that mean older than 13? Or how do we define youth?
I think the age range was 14 for the. I'm not sure what the. Do you know, Dr. Segura?
Yeah, I'm not sure off the top of my head. I can't remember. I can't recall the specific definition that was utilized for that.
So would it be fair to say of the 3,000 unhoused folks in Edmonton, if about 20% are youth, then roughly
likely under 18. But.
So about 600 young people under 18 are living on the street or unhoused. Is that, or is couch surfing? Is that about accurate?
Unhoused, and that would be according to our Homeward Trust data, I believe.
Okay. Yeah, I'm out of time. Thank you.
Thank you. Councillor Knack.
Thank you, Councillor Cartmel. Sorry, I should have asked one more question about those studies. Now that we do have another 453 units of supportive housing coming online sort of as we speak, is there going to be a further study, a further analysis of the individuals who are moving into these units to essentially provide a larger sample size to what we've had with Ambrose Place? We just haven't had this type of opening in some time. So is that on the work plan of anyone?
Councillor, off the top of my head, I don't know. Maybe, I guess, is that a question for our administration or Celine?
Well, and yeah, I would just say that I whenever we embark in these new models of care, or I think we do collect the information to understand what the impact has been, both at an individual level for individual care, but also at a system level and looking at, I know it always seems like it comes down to money, but the cost savings to the system, because then we can demonstrate the return on investment in actually investing in something other than healthcare, but a supported housing.
Absolutely. Yeah. So I guess and I'm not actually sure with the Ambrose Place study, was that a joint study by AHS in the city, or was that done by AHS solely? I don't actually know how that data originally came to be.
I believe that was a joint project between that site and AHS.
Okay.
It was a number of years ago.
It was, yeah, because it opened in 2015. So that's why I'm asking about these new sites that are now getting ready to open up, and is that another opportunity, in partnership with the housing organizations who are running them, with the city and the federal government that funded it, as well as AHS, to essentially, have a greater sample to prove out what we already know to be true, but to make sure we're sort of reinforcing that with more current data.
I think present within any initiative is the need to have an evaluation, and that evaluation both is for funding purposes, funding evaluative purposes, but also to tell the story and presumably good news stories about how we're able to better serve our populations and our communities.
That's great. Okay. So is that something that, what I'm not necessarily hearing is that there was for sure a plan to do that, but is that something that you're going to look into, and maybe to our city administration, that we can engage with folks from the provincial government, from AHS, from these housing organizations, to making sure that we have current data to show the impact of supportive housing?
Yeah, and I don't know what the plan is. We're not, Dr. Score and I aren't really close to this, but we can certainly have it as a follow-up and to look at what the plan is and then communicate back.
Excellent. Again, thank you so much for your time and for all the information. Those are all my questions. Thank you.
Great, thank you, Councillor Knack. I think that's all the questions Council has of the delegation. I'll just make one more call in that regard. And not seeing any, so we'll go to speaking to the motion before I go to Councillor Tang to close. I hear clicking, but I don't see the results of said clicking. So you've got the wheel of death. Councillor Wright.
Thank you very much. I guess healthcare seems to be the topic of conversation at all levels of government today. And I do appreciate all of the speakers that did come in to provide their perspective and insight into the topic. And I think at the municipal level, this is the one area where the public does have the opportunity to come speak, and I don't think at the provincial and federal levels there's the opportunity there. So again, thank you, and for all your information. I think it just emphasizes the fact of the impact of houselessness on our healthcare system. And thank you, Ms. Tesh, for making the comment about we need to look at the return on investment, and I think it's in our people, and how the investment in attending to houselessness and all the complexity that comes with it, how that can have an impact on our overall cost savings in healthcare and in other areas, and most of all, that investment in people to help them to flourish in society, I guess. So thank you again, and I guess I'll be voting in favor of the motion to accept. So thank you.
Thank you. Councillor Stevenson.
Yes, just very briefly to share my thanks again for all of our speakers today. You know, it's been so important to sort of reinforce the significant health impacts that homelessness has, not only for individuals experiencing homelessness, but for all of us accessing the healthcare system. And I really appreciate the reminder of, you know, the important role that housing plays in that, in addition to other wraparound supports. For me, this really reminds me that we know the solutions, that we have many success stories about what works well to improve health outcomes for individuals experiencing homelessness and for our whole community. And so a great reminder of the importance to continue our advocacy and our city investment in this area. This information has definitely given me more insights in terms of specific asks we can be making of our partners at the province, and what we can reflect on in our own practice as a city. So thanks again very much.
Thank you. Councillor Tang to close.
Great, thank you very much, Mr. Chair, and thank you for the delegation and the speakers today in this conversation. Very appreciative. I think it's always incredibly helpful to understand the context of our homeless and houseless crisis through research and data. And obviously this topic is very complex, and we hear that over and over again, and there's, you know, investments and coordination for all levels of government and sectors to ensure that people are getting the care they need, and that we're also reducing the strain we continue to see on the healthcare system through upstream solutions and supports. And I think as municipalities, we partner with healthcare providers, we partner with communities, with province and the federal government, such as the Rapid Housing Initiative that has allowed us to take on, you know, that responsibility of housing. We partner with First Nations communities too in terms of service and housing projects. It's all great stuff. And there's no shortage of actions and partnerships, and you know, even at the higher levels of government, I think there are plenty of examples for all government, cross-government initiatives for that better coordination. I guess I just want to maybe touch on something I do feel is missing from today's discussion, you know, and I recognize that's not the point of today's presentation, but it really made me reflect on, yes, you know, we have solutions, you know, in our healthcare system, in our municipal government, in our provincial funding, et cetera, all of which is needed. And I will argue too, what is equally needed is that community care aspect, how we care and treat and accept people who are experiencing houselessness and in difficult times. I think how we talk about issues matter, how we frame questions matter, and I think there is a need to further shift, you know, that narrative around having neighbors who are struggling, how we, you know, connect with them, and how we build connection and belonging in our neighborhoods to keep people housed. We talk a lot about the need to expand services. For years, city has talked about distributing service and housing across Edmonton. But when it comes down to the implementation of that, I think we continue to see massive pushback. And that narrative continue to focus on public safety. And so and I think we do see, certainly community care in pockets, and there's some great examples of that. But I think collectively, I think there's a lot more work to be done in shifting that narrative, which can actually help with the implementation of much of what we've discussed today that much easier. And I think, just from, the things that I've been involved in over the years, I want to highlight the well-being framework that the city has developed. It was an extensive body of work that really landed on the outcomes around connection, as defined by people who are living rough, connection, through the lens of well-being. Connections to services is certainly one area, but so is our connections to our families, spirituality, our neighbors, cultural identity, et cetera, et cetera. And yes, we have lots of programs and interventions, and there's lots of professionals involved. But I also think over time we've kind of lost that piece around community care. And so I think I just want to put that back into the equation as well. I know it wasn't the focus of today's presentation, but I think it's a really critical piece to ensure the implementation of all that we have been talking about. How we build community buy-in to accept neighbors for who they are and the journey that they're on. And I think there's a lot of takeaway from today's presentation and discussion for the many projects that we are involved with, many tables that we're involved with. And I will also encourage, including our colleagues who are on the various task forces, to think about this balance around public safety and public health. So that's all I want to say, and just thank you again for for the data and the information. I hope we hear from you again soon.
Thank you. Please vote.
We have all the votes.
Please display the vote. And that is carried. I believe Councillor Jans has a subsequent motion.
Thank you for this, and I would like to move that request a further CPSC presentation into the court into invitation with the coroner regarding causes of death in Edmonton, and part 2 request a further CPSC presentation from provincial partners on mental health and addiction in Edmonton. And I see wording suggested by now from the clerk that administration work with the provincial government to invite the medical examiner to provide a report on committee on deaths related to unhoused populations, and part 2, that administration work with Alberta Health Services to invite Alberta Health Services to provide a report on mental health and addictions within the city. So by way of introduction, eminent gratitude to our guests today for sharing. Understandably that there's some things that they don't have, and they recommended us to speak to these parties. So I think we owe it to the public to keep the conversation going.
Great, thank you. We'll just see if we can get that put up on the
Sorry about that. Hold on.
screen.
Okay, just send it to you. We're just loading it right now.
Do you want to recraft that into a part 1 and part 2?
Yeah.
Yeah, okay. Any questions on the motions while they're just get our grammar corrected there? Not hearing any. Any further comments to close, Councillor Chance? Okay, we'll just get the wording corrected and then we'll vote. There we go. Please vote.
We have 4 votes.
Please display the vote. And that is carried. I think that completes our work on item 7.1. We have time-specific item 7.2 at 1:30, so I'm going to suggest we recess for lunch at this point and come back at 1:30 on items 7.2, 7.3, and 7.4, just in that order. Thank you. See you at 1:30.
Live from River Valley.
Good afternoon. I'll call the February 7th meeting of the Community and Public Services Committee back to order. We are now starting item 7.2, possession, transportation, and sale of, I'm going to say bear spray because I can't say these other words. So I believe we have a delegation here from the Edmonton Police Service and a presentation to put forward, so we'll leave it to you. Thanks for being here.
Thank you very much. Good afternoon, Mayor Sohi, members of council. My name is Bart Lazinski, and I'm the superintendent in charge of Northeast and Downtown Patrol. I'd like to thank you for the opportunity here to listen to our proposal. I'd also like to thank the Edmonton Police Commission for their endorsement and support for us being here today. I'd like to start by introducing our team, who have worked tirelessly over the last 6 years to get us to this point. Martine Salaberry from the Edmonton Police Service Legal Advisors section. Martine's online with us, so she's joining us from sunny Sedona. Acting Sergeant Andrew Furman from Northeast Patrol, who has started this project when he was a member of LRT Beat 6 years ago. Diana Layden of our Edmonton Police Service Crime Analysis Unit, who will also be joining us online, and Constable Dan Talek of Southwest Patrol, who was instrumental in the government's portions of regulating the sale of the bear spray. I'd also like to thank David Jones, the branch manager of Community Standards with the City of Edmonton, as well as Dwayne Hunter, Director of Traffic Safety, City of Edmonton, for being here in support of this initiative. Before Andrew starts with his presentation, I understand there's been a lot of rumblings about this bylaw, and there's been some media coverage on it already as to what the potential impacts of this bylaw could be, and I just wanted to address those on the front end. And there's really three key threads that I'd like to address before Andrew starts, which will hopefully become very clear as Andrew does his presentation. So with the safe transport, the intent of this bylaw is not to create an arbitrary search power for the Edmonton Police Service. We understand that's a valid concern. Not only is there no draft wording completed yet for this bylaw, The EPS won't be doing the drafting. If the bylaw is approved, the City of Edmonton will be the ones to draft this bylaw in consultation with the Edmonton Police Service, and we will ensure that all the concerns are brought to the attention of those city folks. With the sale, so within the City of Edmonton, there are various types or sale practices depending on the individual retailer. Some of the larger nationwide retailers have policies in place that align with federal and provincial rules around OC spray. The intent of this bylaw would be to have all retailers comply with federal and provincial rules in a consistent manner. And the last one is, we are not here asking to ban bear spray. I think those will be very clear once Andrew completes his presentation. So with that, I'll hand it over to Andrew.
Thank you, sir. Good afternoon, members of City Council and Committee. I'm Andrew Furman, and I'm an acting Sergeant in Northeast Division Patrol. I'm here to present to you work completed over the past 5 years by sworn and non-sworn members of EPS. I appreciate the opportunity to speak with you. This presentation is to speak about the transport and carry regulation of oleoresin capsicum sprays, as well as sales regulation of these sprays at a municipal level. Next slide. Oleoresin capsicum spray, commonly known as pepper spray, is a defensive weapon in an aerosol canister which contains chemical irritants. These chemicals irritate the mucous membranes, such as the eyes, as well as the respiratory system. There are multiple types of oleoresin capsicum, or OC spray, as I will refer to it. This includes prohibited for human use and non-prohibited sprays like dog and bear spray. Bear spray, in general, is in a higher quantity, higher concentration, and has a longer range for standoff distance. Bear spray has a longer lasting effect on the area it has been sprayed, especially in an enclosed place with poor ventilation. A discharge of any OC spray, especially bear spray, has an impact on resources for Edmonton Fire, Edmonton Police, and emergency medical services. There is not only a cost associated to using these services, but also causes disruption in service delivery. Edmonton Fire has advised that when dispatched to assist in an OC deployment, that on average they send 1 to 2 trucks and spend approximately 1 hour on the event. EMS has anecdotally noted that they can spend between 30 minutes up to several hours on an incident where someone has been bear sprayed. If the patient they are with is transported to hospital, they must either be relieved by another unit or wait until a nurse takes over. The discharge of OC spray also has impacts on the use of dwellings, businesses, and transit. Although the examples I am here to speak about involve a criminal discharge, these same conditions can also exist in an accidental discharge. A 2017 robbery in the food court at Crossiron Mills outside of Calgary resulted in 20 people, including 7 children, being affected by the spray, while an additional 6 were treated by paramedics. Last year, I attended a call in the Dickensfield area where bear spray was believed to be deployed in a multi-unit building. Upon entering the floor of the discharge, I noticed the effects immediately, despite being in another section of the building. Numerous people had to be evacuated into the cold, and a mother and her children were sent to the Northeast Medical Center for precautionary purposes. Next slide. OC spray that is often seized by EPS or other law enforcement stakeholders has been manipulated. This includes the manufacturer labels and recommendations being removed or covered. On bear spray, which uses a safety wedge for a safety, this wedge is often removed or just plainly not in use. With the labeling missing, any person looking at the canister cannot say with 100% certainty what is contained within. Federal and provincial legislation do exist, however, they do not provide law enforcement stakeholders with a suitable remedy to deal with the defaced or unsafe OC at the time of the interaction. This is due to the fact that these are complex investigations which culminate in large fines with no ticketing options. The statistics used for this presentation are based on criminal occurrences. However, we are looking to regulate the public nuisance aspect of a non-criminal discharge of OC spray. At this time, I cannot speak to the number of non-criminal discharges, as it may never be reported to police or cannot be filtered out in our data collection. Next slide. A photo of some examples of seized OC spray taken at the property exhibit unit. It should be noted that the plastic or saran wrap is placed on the devices by us. As you can see from this photo, there are multiple types of spray in varying states. Some labels are present while others are covered or removed. Some of these canisters may even be prohibited. However, we cannot be sure. Of note, bear spray canisters are designed around a fire extinguisher type design. It can be seen in the picture that the orange canister is missing the safety device or safety wedge. In this state, a depression of the trigger will cause a discharge. Next slide. Non-prohibited OC spray products are more commonly seen sold at sporting good and camping stores. They can also be found in some convenience type stores within the city. Several beat members have advised me of stores on their beat selling such products. These include downtown, northeast, northwest, and southwest divisions. For point two, I just am going to clarify the wording around this. As bear spray sales are currently duly regulated in Alberta, both federally under the Pest Control Act, which police do not have authority to enforce, and provincially under the Environmental Protection and Enhancement Act, which the police do have the authority to enforce, there's also a lack of clarity on the rules for selling bear spray. For example, the Environmental Protection and Enhancement Act dictates that no person shall sell, distribute, use, apply, handle, store, or transport a pesticide, which bear and dog spray fall under, except in accordance with the regulations with respect to that pesticide and the label for that pesticide. If we look at the label for one of the most common bear sprays in Canada, Sabre Wild, it states, for use by authorized customers where the vendor maintains a record of sales, including the name and address of the purchaser, amount purchased together with a signed notice of purchaser. However, the label does not dictate how long these notices need to be held for. However, Health Canada dictates that they must be maintained for 2 years. It also does not address the age of the purchaser, nor how their identity is to be established. Most sporting goods stores have imposed additional internal policies which dictate that bear spray will not be sold to a minor and that that person purchasing it must present government-issued photo identification to confirm their identity prior to purchase. Without clear guidelines and directions for sellers, it is up to the individual business to proceed with what they deem to be best sales practices. Other jurisdictions, such as Chilliwack and Surrey, BC, have incorporated bylaws for the sales of OC spray, such as bear spray. We are looking for a municipal regulation here as well. Next slide. It should be noted that due to data collection limitations, the numbers observed on the graph do have a margin for error and may have included additional occurrences where a type of OC spray was mentioned in a report, however not used in any way. The title also says bear spray related occurrences, however the data includes numerous names for OC sprays that are commonly referred to, such as mace or pepper spray. The data set collected was from 2015 through 2021. 2016 saw a slight drop from 2015 along with a drop from 2020 to 2021. However, the general trend in occurrences is up over this time period. After the 2019 year, there was a substantial increase in occurrences, which has now almost effectively doubled the number of occurrences since 2015. 2021 has a 91% increase from 2015. This proposal was completed prior to the year end of 2022, and as such, the data is not reflected in this slide. Next slide. Prior to getting into the data, I must acknowledge that there is data overlap with these data locations. As a result, you may notice that the totals are larger than 100%. One would expect a green space to have a large number of OC spray occurrences. However, they account for only 2%. The highest number of occurrences fall within 100 meters or one city block of a bus stop, with 62% of all occurrences happening here. Within 400 meters or a couple of minutes walk from a school, 46% of occurrences. As one would expect, there is data overlap with the bus stops, as it can be presumed a school will have a nearby bus stop. Next slide. In summary, the deployment of OC spray, whether intentional or not, has a profound effect on the resources and service delivery of emergency services. Business patronage and transit ridership can also be affected. Residents can also be impacted, which can be especially devastating to people with nowhere to go during the winter months. With a lack of tools for frontline police stakeholders, we require a remedy to prevent the non-criminal discharge and carry of OC spray. We are asking for a bylaw focused on the seller and individual purchaser that incorporates the safety features that the federal and provincial government have deemed appropriate at the commercial and manufacturing level to the municipal level, thereby giving law enforcement stakeholders a reasonable tool to assist in the prevention of non-criminal discharges and unsafe carry. As well, maintain a general guideline for individual vendors or sellers. Next slide. Thank you for your time. Are there any questions? I'll leave it out.
Thank you. So I'm sure there are many questions for you. We'll start with Councillor Wright. You selected this.
Thank you. Does administration have a presentation? Or?
Yeah, I had the same question. So I will confess to some confusion. So the report in our materials looks like an administration report, and it includes a recommendation. Is that coming from administration, or is that just coming from the police service? Or through the police commission to the just the commission?
Just the commission.
Okay. So
this is kind of the first time that that's happened, where it's come directly
it's not the
from
first
the commission?
time, no,
okay.
but usually there's some accompanying material. Did you want, Ms. Bluth, did you want to comment? We'll just set up the process. We'll start your time again.
Thank you.
Yeah.
This is, administration did not weigh in on this report. It went to city clerks and then off to council. So we did not weigh in on the content.
So all the materials in front of us came from the police commission, from the service through the commission?
Correct.
Yeah, okay, thank you.
So can I ask any questions of administration then, or is it just to the police service?
Depends on your question. I mean, if it's the content of the report, it's to the service.
Okay, and then I will ask, I guess, administration in a second, a few other things. I'm just wondering, so I don't know if this is within our jurisdiction, because you said sales are regulated provincially. So do we even have the authority to put into place a bylaw such as this?
Martine, do you want to field that?
I'm just thinking, if you're looking for clarification on the provincial laws, then shouldn't you be going to the province for that?
Hi there, Martine Salaberry. I'm Edmonton Police Service Legal Counsel. And not necessarily. When looking at bear spray, it's regulated federally, provincially, and then sort of a gap when we get to municipal. And everybody has a different role and oversight, and there can be a bit of overlap. The federal and provincial legislation is really aimed more at those large-scale users, manufacturers, distributors. Could we, as the Edmonton Police, try to fit in or squeeze in by our enforcement out of the Environmental Protection Enhancement Act? We could try, but it's really not the right tool or resource. It would require, instead of being able to ticket someone, or we'd have to go to court, judges, courts involved. The person wouldn't be able to just pay a fine. They'd have to get a lawyer. It's a very complex process that the fines are, under the Environmental Protection Enhancement Act, I think the fines are $1 million or more. It's really meant at that commercial level. And what we're looking for from the city is more of a, for the unsafe carry, at least, more of just a simpler option if we choose to ticket someone without sending them through the whole process down the Environmental Protection Enhancement Act, because it's very complex and nuanced and it feeds off the federal act.
Okay, thank
and
you.
It's really
I'm just cognizant of my time here, so thank you.
Okay, sure.
I'm just thinking, you know, one more layer of laws in that might just muddy the waters even more rather than getting that clarity from the province or federal governments. And I'm just wondering, can you define for me what is a non-criminal discharge?
Well, I can define a non-criminal.
Okay, sorry.
No, you go ahead.
No,
Sorry.
no, go ahead. I thought one of our police service members was going to do that.
Yep, go ahead.
Okay.
Yep.
Thank you for the question. So non-criminal discharge would be a discharge in which a criminal offense has not been committed. So it's not being used for an assault, a robbery, or anything to that effect. So non-criminal discharge would be there's no intent of anything criminal. You have in your bag bear spray. The bear spray, for whatever reason, doesn't have the safety involved on it. Now, something in your bag depresses that safety and it fogs the entire transit bus. Now, that would be a non-criminal. There was no intent by that member of the public to set off their bear spray under that condition. However, so it doesn't meet any sort of criminal threshold.
Okay, so the act itself of discharging is not considered criminal?
Yeah.
Okay, okay. And then I guess I just do have another question for administration. Is this something that's already being considered in your review of the public places bylaw?
Yes, it is.
Okay, thank you. I'll yield the rest of my time. Thank you.
Thank you. So I'm looking at the recommendation here, so I'm just kind of want to just quickly ask one by one. So effectively, I think what I've heard is that the service would like a city law to be enforced locally, because the other laws are difficult and bureaucratic to enforce, essentially. Is that fair? Yeah, at least in part.
That would be fair, yep.
And there's an apprehension that bear spray is being used to commit crimes, to assaults, robberies, harm to other people. Yes, that's part of the apprehension.
Sorry, can you go with the question again? Part of the apprehension of?
Well, that's why you're asking for a law, is that people are using bear spray on other people.
Yes and no. We want something that governs the safe transport of it. So we have, and Martine can field this from the legal perspective, but we have laws that obviously govern the criminal discharge of it. But what we'd like to see is something that governs the safe transport of it from a non-criminal perspective. And Martine, can you just piggyback on that, please?
Certainly. Yeah, we're not actually looking for any sort of criminal authority to do with robberies or anything. If you use any type of spray, bear, dog, anything against a person for a robbery, the criminal code has enough authority. Just during our involvement with bear spray, we noticed the gap in bear spray, but it's not meant to cover anything criminally.
And that gap is carrying bear spray with you. It's the transport.
Yeah, the gap. Oh, sorry. Go ahead.
The gap is the transport of bear spray in an unsafe manner. No trigger guard.
100%. The transport as well as the unregulated sales, because like it was explained earlier.
I was going to come to sales. Yeah. So on the transport part, I want to make this really clear, because then I want to say, if it's really clear and it's really clear to administration, do we actually have to make this recommendation? Because I'll be speaking very plainly. I don't want to make any more motions because we've got 140 motions on the floor. So if they don't need instruction, I don't want to give it to them. So if we're looking for a law that says you're not allowed to carry bear spray without a trigger guard, and if we're looking for a law that says you're not allowed to sell pepper spray or bear spray to people under 18, and we want a law that says if you sell bear spray, you got to maintain some sort of a log of who you sell it to, verification of identification, of age, of address, what have you. Is that essentially the essence of the law that we're asking for?
Go ahead, Martine.
Yes, absolutely. The only very small part missing is maintaining the integrity of the label. But other than that, exactly correct.
The integrity of the label, okay.
And that integrity of the label is key because there's no other way to define whether this is a prohibited OC spray or if it's a non-prohibited OC spray.
Why the concern around the transport? If ultimately it's discharge for a criminal matter and that's covered in the criminal law, I mean, aside from the accidental discharge, you know, given the example you were given, is it only that, the potential for an accidental discharge?
Thank you, Councillor. So from a frontline policing perspective, where this comes into play is there's a little bit of a gap. So we obviously know that there's that criminal portion where we can act. Now, in our duties, we'll come across a situation where we arrested somebody for somebody else, we've done a search of their person under our authorities, and we find a bear spray canister that's in the condition explained to you, tampered with or not having a safety device. Now, it's clear that a reasonable person would think that, hey, this isn't good, like we shouldn't let them walk off with it, but unfortunately as it stands, we just allow them to continue. So I understand your question to, I think it more goes towards like our actual day-to-day duties and what we're seeing rather than these criminal things where we obviously have a remedy and we don't have a remedy right now to try and alleviate a situation that we believe could potentially go sideways.
You're seeing something potentially lethal that you can't do anything about and letting a person walk away with it potentially. Yeah?
There's that potential, as well as like we're saying about the public nuisance aspect of it. Even if they don't have the intent to ever use it in a criminal manner, there's the example I used of on the bus or in a mall.
Or a young kid. Yeah. That's my time. Mayor Sohi.
First of all, thank you so much for the report and the work that you do and bringing this forward for our consideration. A couple of questions just for clarification. So OC sprays, if you have it, the possession is not illegal, right? And the use on humans is illegal, right? But the purpose is to, as long as if a bear spray you want to use on a bear, that's legal, but not on humans. Okay. On the data that you have collected, do you have any further breakdown around gender and other demographics? Because I'm trying to understand why would someone carry a bear spray when they don't intend to use that for that intended purpose? Like, is it perception of safety, or is it they using it for? Is it for criminal element, or is it for more of a defensive element? That's what I'm trying to understand. If you have further breakdown on the gender and the demographics, say racial breakdown.
Thank you, Mr. Mayor. Diana Layden might want to weigh in on this. She was the criminal intelligence analyst that weighed in on the report, and we did talk about the demographic factors. I believe it was with commission earlier, so I'll let Diana speak to that.
Okay.
It's Mark Trimble just here with Diana. Just to speak with that, so Canada doesn't have a national standard for the collection of race-based data, nor the categorization that is to be collected. And similarly, the Edmonton Police Service does not have a standard for the collection of race-based data, nor the categorization that is to be collected. So as a result, there's no consistency to the EPS collection of race-based data at present. So the data is kind of anonymized from us. We're not looking at the gender and the race when we prepare this.
Okay, so maybe let me ask this another way. In a way, what I'm trying to understand is that people carrying this stuff for defensive reasons, like they feel not safe, right? Or they doing it for to commit a criminal offense.
I think there's a variety of different reasons why people might carry it. I think some of it might be for self-defense, whether it be used against a dog attack or anything like that for those reasons, or there's obviously the criminal element that carries it to.
And we don't know based on the data, like what is the balance, right? Is it mainly criminal element or is more defensive? We don't have that breakdown. Okay.
No, Mark and Diana, I don't believe we have that breakdown.
We do not have that breakdown at this time.
Okay. Okay, that's all. No, thank you for just. I'm asking those questions just to understand my perspective. But thank you for bringing it forward. I think this is something that we need to consider. Yeah, support of that. Thank you.
Thank you, Councillor Stevenson.
Yeah, thank you so much. Really appreciate the report. Really appreciate the work that's gone into it. I think it's a really sensible approach. I think it's a good tool to add to our toolkit. Yeah, you know, I appreciate the clarification. So it's not introduce any new stop and search powers. It's, again, if you have the lawful authority to be searching someone for other reasons and you see that, you can confiscate it, whereas now you're not able to. Yep, that's great. I think that again, very sensible, a good approach to avoid putting these types of scenarios through the judicial system, reducing the strain on that system. So very supportive of that. You know, the other piece I really appreciate is the education for retailers. I think, again, sort of addressing the point of sale, that will be a great way to address the supply, sort of in a proactive way. And just a question around, well, and this might be to Ms. Plouffe as well, but maybe to the service first. Would the intent be that EPS would be sort of leading that education with retailers, or would you want to be partnering with the city and our bylaw officers to do that?
Thank you for that question. My portion of this has largely been revolving around the sales and trying to kind of get a more consistent approach. I think that it would be safe to say that it would be fantastic for us to have a part in that, but obviously we would love to work with our community partners, our peace officers, the city council, just to make sure we get that information out as effectively as possible to the greatest number of people possible.
Yeah, and I can see some great alignment there in terms of you know, the city helping with the communications when business licenses are sent out, having I mean, even just having all the addresses of businesses that can be sent out to. And I think, well, I see Mr. Jones coming up, so if you wanted to weigh in, I know that your resources are always, you get pulled in many directions, so just wondering your thoughts about the resources you could commit to that and how we could partner effectively with EPS as well.
Sure. This would fall into our complaints and investigation section with our current business licensing and enforcement through the municipal enforcement officers. So that's, I mean, the education piece we could take care of, but obviously we'd have to get a good survey of how many places are selling this and look at what that meant from a resourcing perspective for us.
So Ms. Plouffe, you mentioned earlier that some of this work around the sort of transportation and modification, that is already contemplated as part of the public spaces bylaw review. Just wondering about the business license side of things. Is that work initiated in any way?
No, we haven't looked at it from that perspective, although we have done some jurisdictional scans and have some information about what other municipalities are doing. What we do need to do, though, is have some consultation with those folks. And whether, I mean, they have a particular direction of where their business license parameters are quite permissive. And I just think we need to take a bigger picture perspective. Not saying I disagree with OC spray, I don't, but I think we need to be coordinated and mindful of what we have heard from council. We have heard feedback about fines, we have heard feedback about you know, how, you know, GBA plus analysis around our transit spaces. So I think we just need to take a coordinated perspective on all of these issues, but it is something we have considered as a part of our bylaw project.
Okay. So just to the question earlier, does the recommendation as presented prevent you from doing that more holistic look? No? Okay.
No, I mean, I think we're already doing it, but to the chair's comment, I don't think we need 4 more motions to start to do this work. I mean, I think we are doing it. We have chatted with EPS kind of about their perspective. Their report is very informative and can help guide the work that we are already doing.
And just to be crystal clear, public spaces bylaw work is underway, and then the business license work would also be initiated?
Well, I mean, I think that's something we need to connect with that team to see how they want to approach the business license bylaw perspective.
Yeah, and you're right in terms of that broader conversation. I mean, I think there's a really big conversation with the business license as we go through zoning bylaw renewal. I think business license might need to, as the zoning bylaw gets more flexible, I think our business license needs to become a different tool in some ways.
Yeah, and we just need to understand what are our needs, what are we trying to achieve, what is a municipal purpose for taking this step, and will what is being suggested, will it meet the needs of Edmontonians? And you know, so I think chatting with David's team is going to be very important, because if we've got enforcement issues, that council is asked quite often, well, why are we doing that? Why are we doing it that way? So I think we need to take a coordinated look.
Great, thank you. Thanks very much. Thanks again for the report.
Thank you. Councillor Rutherford.
Yes, thank you. Just to piggyback off of that line of questioning, just to confirm though, when I actually read the first motion in the recommendation, it is directive. So it wouldn't just be contemplation of that within the bylaw, it is directing an amendment with that inclusion. Is my understanding correct if this recommendation was to be put forward? Ms. Plouffe?
Yes, I read all of them as directive.
Yeah, so it's not contemplation, it would be direction to go forth with that.
That was my read of the motions.
Yeah, that was my read too. Okay. Yeah, I have to EPS, I have to say I am still a little bit confused, because you know, I'm familiar with the criminal code around OC spray, and even, you know, it's considered a weapons offense to have it. And I'm seeing that there's some muddy water around specifically bear spray, but OC spray comes in multiple different concentrations, and most of which are illegal. Is my understanding correct?
Martine, go ahead.
I wouldn't classify it by concentration. Under the criminal code, if any sort of OC spray is designed to be used against a person, then it's a prohibited weapon. If OC spray is designed to be used against an animal, then it is not a prohibited weapon. Anything can be a weapon. A pencil in your pocket can be a weapon if you use it as such. So for me to carry bear spray is completely lawful. If I choose to use it as a weapon, then it's the same idea as a pencil. The only thing that's prohibited are OC sprays that are specifically designed to be used against people.
And just on that note, the only way we know that is through the manufacturer label.
Yeah, no, I think the manufacturer label is an interesting piece. It's just very, it's really shifting my paradigm right now, this conversation, because I didn't, you know, we talk about self-defense. I was under the understanding in Canada, you could not carry pepper spray for self-defense. Because wouldn't that be the intent to use it on another human?
Yeah, the criminal code defines it as the item itself being designed, so not your intent.
Yeah, I think that this is where, yeah, okay. I'm gonna leave that question for now. So there's no way to confiscate, to take away OC spray, even with the layers of, because like in my interpretation of the criminal code is very different. And maybe that's because I was specifically looking at in relation to, do EPS officers carry OC spray?
Yes, we do.
What is the concentration of the OC spray that EPS carries? Is it higher or lower than bear spray?
It would be higher.
Yeah, that's what I thought. So when you said
the bear spray is higher.
The bear spray is higher? Is it by what percentage higher?
Sorry, Council, I wouldn't have that information available in front of me, but our OC spray that we carry is designed for use on people.
Yeah, no, I know, that's what I'm recognizing. Yeah, that's where the distinction is. It's very interesting. And so right now, some businesses have regulations on who they sell to and others don't. There's no municipal levers on that. Is that correct?
That is correct.
Can you just break it down for me quickly what like it would look like in practice? So if this recommendation went through and this bylaw was in place, how would that change the work that you're doing? Like, how would that help?
Councillor, if you're asking specifically in relation to the sales portion, it would just make sure that everybody was on the same page. For my portion of the project, I spoke to a lot of the major outdoor retailers, MEC, et cetera, and they all have kind of an above and beyond process in place. So they're already asking for identification. They're making sure that people are above the age of 18. They're keeping those records. MEC specifically keeps them for 3 years, which is above what the Pest Control Act even asks. So we're basically just trying to get all of the other retailers on the same page to ensure that everybody's held to the same standard.
Okay, thank you so much. Appreciate it.
Thank you. Councillor Salvador.
Yeah, thank you, Chair Cartmel. Thank you for bringing this report forward. I will say that this has been an ongoing issue in Ward Métis, which does seem to have been ramping up lately. And I know in conversations that I've had with legal about the best approach to addressing this and what tools we can add to our toolbox to prevent these products from being sold in an uncontrolled manner. I see a lot of that reflected in the recommendations that are in front of committee. So maybe just a few questions to Councillor Cartmel's point and Councillor Stevenson, just around sort of the recommendation that's here and whether or not you need a motion for the business licensing piece. To Ms. Plouffe, you did mention it would be helpful to directly connect with the business licensing team on that portion. Is that work happening, or do you need direction on that?
So I think our friends from EPS are connecting with them at the end of the month, I think. So I think we would just coordinate that meeting together.
Okay, great. So everything that is in this recommendation is happening?
Yes.
Great. Okay, then maybe just some higher level questions. I was particularly interested in some of the municipalities in BC who already have this in place. Can you share any information on how successful that bylaw approach has been in BC municipalities?
Unfortunately, we can't, and I'll let Diana answer why, or Mark, you can answer why. Yeah, there's pieces to it that they couldn't share with us, but I'll let our criminal analysis unit answer that question.
Yeah, unfortunately, we have very little data from other municipalities, and we haven't been given permission to publicly share what we do have. So unfortunately, nothing further at this time.
Okay. And I guess I understand one of the two BC municipalities, it's a relatively recent bylaw change, is that right? Like a year ago, I believe?
That's correct, it's 2021.
Yeah. Okay, and then just, locally, why have we seen such an increase in OC spray related occurrences in the last few years? Can you shed any light on that?
Councillor, thanks for the question. I don't think there's any specific reason or cause to point to at this time. There's obviously over the last year, there's been an increase in violent crime overall. And so it's very hard to, without being an analyst, it's hard to predict why things are happening the way that they currently are.
Does it have anything to do with the availability?
I think that in our position, we can't speak to how the availability is.
Sure. Okay. Yeah. And again, I'm just reflecting on what I've heard from constituents. Convenience stores. On a regular basis. Every few blocks, it's available. And maybe I'm looking for some clarity around when are stores actually checking ID and requiring paperwork to be filled out? Like, is it a voluntary process? I understand that the business licensing bylaw could provide that additional clarity, but what is happening right now?
In my experience, I've noticed that there is a huge disparity in relation to that. Like I said, a lot of the kind of major outdoor retailers are holding themselves to standards actually above even what the federal government does. But there isn't a lot of education, and there's basically nothing holding the smaller retailers to those standards. And as a result, specifically, I was involved in a project where we worked with one problem location. I was a member of White Avenue Beats, and we worked with them for over a year. And I can't speak to whether their claims were based in ignorance or what the case may be, but they weren't following the regulations, and they were seemingly unaware of them. And once we brought them to our attention, their adherence was low, we'll say.
Okay. Yeah, that's helpful. So when you're saying larger retailers, you're saying sort of the like sporting goods, yeah. Okay. Alrighty. That is helpful. Maybe one final one. So I understand that some provinces impose sort of similar requirements at a provincial level. Is that being considered here? I think there was mention that Calgary Police were looking to implement a similar bylaw, similar approach. Where are those conversations at?
I can speak to the provincial level. I've been in contact with the province for the last couple of years as a result of my work. It was actually on the docket to be looked at in 2023. However, due to a shortage of staffing, they've actually extended the bylaw or the current provincial regulations as they stand until 2028. So it's not going to be tabled until that point, and so they won't look at it until 2026, 27, when they start to look at potentially making changes at the provincial level.
Okay, thank you.
And to answer the question there, Councillor, about Calgary, they had started the initiative actually prior to us, and the last time that I spoke to the member, it wasn't progressing forward from their standpoint.
Thank you. Councillor Tang?
Maybe just to pick up there, why?
I can't speak to why that member didn't proceed to continue. As you've heard, I've been working on this for 6 years, and so sometimes you go through those ebbs and flows, right? And I'm not sure what, like I said, they started prior to me, and so they'd be way past 6 years at this point, so I can't speak to that.
Yeah, fair enough. And then just on kind of the experiences of some of these other municipalities, I think one of them started in 1998, which is a fairly significant time. While you don't have information on their implementation successes or lessons learned there, but I'm wondering, any insights on like cost, just in terms of, because of the gap that's been filled, resource has been shifted to maybe focus on other policing priorities or whatnot, or increasing costs in terms of other kinds of enforcement, like that kind of insight.
So we don't have anything with regard to the costs associated to them implementing their bylaws. Now, I guess from the city's perspective here, we're looking at any reduction in the number of these occurrences is going to hopefully result in a reduction in cost or disruption of services, cost reduction and a reduction in having to, I guess, have your EMS, your EPS, and your fire attending these occurrences, and they all have a cost associated to them, which we obviously, it would be hard to measure that, but we do know that if we're able to reduce the amount of these occurrences, there should be some sort of cost and service benefit to the city as a result.
So, as well as a capacity issue and creating some capacity in that.
Yeah, and then that Dickinsfield example you had cited, that would be like one out of 3,200 of those instances. Am I interpreting that data right?
At least to my knowledge of how and Mark can speak to it, but as far as I understand it, that would be the one occurrence.
Okay.
Yes.
32, yeah, that is alarming, and I'm alarmed by the fact that's close to schools, bus stops, etc. And then I'm wondering from our end, on the bylaw side, do we track these kind of data? Like, what, are we seeing similar kind of uprise, or is our data kind of looped into that graph we saw earlier presented by the service?
Well, I think there may be some crossover between our data, but I know that from our peace officer standpoint, we're seeing a similar increase in the presence of pepper spray or bear spray across the city. Yep.
Yeah, thank you very much. I appreciate the report. Certainly learned something I'm not very knowledgeable about, but I guess I'm just to this whole conversation around sort of the recommendation. The way I interpret it was actually, okay, we're doing a public place bylaw, broader review, and this will be part of that, rather than the directive that, Ms. Plouffe, you had mentioned. I guess, if we say, okay, this feels redundant and we're already doing this, and maybe there could have been more conversation ahead of this particular meeting. I mean, I understand it's something you've been working on for a long time, and I'm sure there's lots of discussion at the commission level. I mean, what would the impact of that be? Because it wouldn't change your day-to-day in an immediate way, because there's, the review, I think, is coming back in Q4, right?
We're aiming for Q3.
Oh, okay. Right. So I guess I'm just wondering, like, if we don't table this, what happens?
Counselor, who are you asking that question to?
I guess I'm looking at the service first, but I'm also looking for some insights from you, because I feel like there's a bit of a coordination, issue today, and could this have been better coordinated, that rather than maybe a recommendation report, it would have been an information report, with consideration that, recognizing this is work that is already happening.
So my request to council is to accept it for information with, we have chatted about the work that we are doing. Our aim is to try to get to Q3. We're working on engagement. And just a little comment in terms of the recommendations as you see them. Our plan is for the public spaces bylaw to be repealed. So please don't put a motion that tells me to amend the bylaw. It's the plan is to be gone. We are now taking a holistic view, rewriting an entire bylaw. So
it feels
just
like a sequence
small
thing.
perspective.
Yeah.
But of course we will collaborate with our partners. We need to understand what are they missing out of the criminal section. Absolutely, that has been the work that we've already started.
Sorry, any comments from you quickly?
Martine has
okay.
had several conversations with the City of Edmonton Legal Counsel, so maybe she can provide some perspective on some of those conversations.
Go ahead. Oh, I think you're frozen.
We have connected. So
okay,
we
great.
have connected.
Okay, great.
We didn't, connecting on the report, that didn't happen, but we have connected in the background. They're aware of the work that we are doing. We're going to continue the work we're doing, and we will continue our collaboration.
Appreciate the advice. Thank you.
Thank you. Councillor Jantz.
Thank you. I'm looking at a news story from July 21st, 2021, where Justice Minister Casey Madhu wants pepper spray for all and suggests that the government should not only change the criminal code, but he talks about the efficacy of pepper spray as a self-defense tool. Does the service concur with his comments?
I'm not sure we can speak to that. I don't know what that entire report or what that news headline actually read, so I can't speak to that.
Quotes here, it is sadly ironic that a vulnerable person...
I'm sorry, Councillor Jantz, I think that's really unfair to ask the Edmonton Police Service to comment on comments from 2 years ago from a provincial minister.
I guess where I'm confused is that we have a provincial government that's suggesting that this is a valuable self-defense tool, and I just want to set the record straight that is that the case here?
No, I'm sorry, I'm going to cut that off. If you have questions about the report or to the service about the report, or even to Ms. Plouffe about the report in front of us, we can stick to that. I just cannot in good conscience allow conversations to take place here that are talking about an article quoting somebody else that's not part of this meeting from 2 years ago. Sorry.
Well, there's a letter here to the federal government from the provincial justice minister. It's not an article, it's a letter. Like, our government is advocating for changes to the federal government's criminal code. Whatever we do here may be overridden by the provincial government. Like, I think this is actually, I think we do need to all get on the same page, not just the City of Edmonton and the police, but also the provincial government here. This wasn't just an offhand comment to the media. This is a letter written to the Attorney General of Canada advocating for changes to here. So, all
we can speak to is the safe transport aspect of what we're actually proposing here. And not, I mean, again, I'd have to read up on exactly what that letter said, but our proposal with respect to the transport and the labels is what we're talking about here today.
So when the service alluded to the provincial government is looking at changes in 28 or 20, 26, 29 maybe, what changes are they going to make?
Councillor, we can't speak to that because it has been tabled for the next 5 years. I've asked to be included in that conversation, but that conversation hasn't started yet. And those conversations are going to take place around the Provincial Environmental Protection Act. So frankly, what the provincial government's going to do between now and then is, it's out of our hands.
Yeah. I would concur with the position, what I perceive to be the position of the services. We don't want people carrying pepper spray for self-defense. We don't think it's a good idea for Edmontonians to be doing that, and I think that's the position of council. And I don't know, as part of this public spaces review, if we need to make that more clear to the minister and to the federal government if they're looking at changes, or if the province is looking at changes. I don't think it's a good idea that Edmontonians should be arming themselves for self-defense with these tools. So I certainly support the recommendation, and I'm concerned about a disconnect or a message that's contrary to this being shared with the federal government. So maybe it's something that we could bring up at the task force on on safety, or maybe it's another avenue. But I'd like to ensure we're on the same page. Thank you.
Councillor Wright.
Thank you. My Google search results shows that Ottawa denied that request. Anyhow, I was going to ask Mr. Jones about, from a peace officer perspective, if you were seeing the same sort of use of it, but you've answered that. So then I'm also wondering if some retailers are able to adhere or exceed the guidelines, why aren't others? And yeah, why aren't they? I mean, they ID for cigarette sales, right? So why not this as well?
Councillor, my understanding is, honestly, a lot of it comes down to discrepancies between the regulations. Like I said, this is duly regulated, so it's regulated federally under the Pest Control Act, which is something that we as the police don't have any authority to enforce, and then regulated provincially under the Environmental and Protection Act. As Martine alluded to earlier, it's not something that's regulated in way of something we can go in and give them a ticket for. It's something that they would, if they were charged, the fines are frankly astronomical. They would have to go to court. It would be a big ordeal. And a lot of it just comes down to, with the two legislations being in place, there isn't a lot of clarity for the people who are selling it. So one of these things would be to make sure that everybody's on the same page and hopefully bring up that standard a little bit to make sure that, kind of best practices are being adhered to by everybody.
So if those fines are astronomical, isn't that more of a deterrent than $100 or $250 fine? Can the police enforce that and charge them with those astronomical fines?
It's not something that we as the police actually set the fines. It's something that if they were found in default of it, and again, I'm not a lawyer, so please bear that in mind, we would compel them to court, and then it would be up to the legal system to actually make those fine recommendations.
So there are tools in place to try to have them adhere to those laws, right? It's just they're chosen not to be used.
Not necessarily not to be used. They're just not very clearly defined, and they're also not very well articulated, if that makes sense. We think that we could make it a lot easier for people to comply with regulations if they were laid out in a straightforward manner, versus looking at federal legislation for one thing, provincial legislation for another thing. It's kind of hard to put an onus on like a small business owner to know a whole bunch of stuff about things that, they might not have had the opportunity to look up or have lawyers that could help them with.
Okay. Well, I was looking at maybe amending the motion to be less directive rather than saying that administration include, to have it administration consider, but I think the work's already being done. And so I would just like to make the motion that the February 7th, 2023 Edmonton Police Service Report EXT 01614 be received for information at this time.
So we have a motion on the floor. Did you want to introduce it at all, Councillor Wright?
I just believe that the work is being done in both aspects, working with the Edmonton Police Service, and yeah, why confuse matters more.
Okay, thank you. Further questions either to the delegation or on the motion? Mayor Sohi.
Yeah, I was going to ask the service, in light of the conversation that we have had over the last hour, I was prepared to move this recommendation, but as you heard from the legal counsel from city, this work is already underway, and you're comfortable with that? Because I want to respect the work that you've been doing over the last 5 years and 6 years, and these are common sense changes that we need to make. Are you comfortable with the process that is already underway in the city and working with the city under that process without having this recommendation given?
Thank you for that, Mayor Sohi. Yeah, just having a sidebar conversation. In listening to city administration, I don't get the idea that the regulation work is being done just quite yet. But if we included that in part of the work, then I think we would be satisfied with that. I think that's the piece that might be missing, if I'm not mistaken.
So which component is missing? Which regulation are you referring to?
Regulating the sale.
Regulating the sale.
Regulating the sale.
That'll be under the business bylaw, right?
Right. So, I mean, I think what we've heard is that we've got a meeting, or at least our friends from EPS have a meeting with our folks. I've heard council today. I've heard that you want us to look at that aspect. We will absolutely include that as a part of the work we will do going forward. It wasn't originally, just to be clear, I wasn't originally a part of our entire bylaw review program, but you know, it's also hard to regulate one part and not consider the other, which is a business license piece.
So the public places bylaw, that is under review, right? And that work is pursuing, and you will include EPS in that. So that is clear, but I think where lacks clarity is the business license bylaw part, right? But I would hear from you, Michelle, is that you will undertake that and work with EPS.
We commit to doing that, Mr.
Okay,
Mayor.
good. Okay, that is okay. Now, just want to get a sense. Is that clear to you to the service, right? That work will be done.
Thank you. Yeah, yes, it is, Mr. Mayor.
And
Thank
you'll
you.
find then not moving forward with the recommendation and just receiving this for information and undertake that work with administration. Okay, good. Because this is important. I just want to make sure that we acknowledge the work you've been doing and that we support these changes. Okay, good. That's all. Yeah.
Thank you, Mayor Sohi. Councillor Tang wants to speak to it. Any other questions from anyone? Councillor Tang?
Okay, yeah, no, I just wanted to support the resulting motion here. I recognize, just to echo, yeah, lots of work has been done, and perhaps it will maybe save some work on the other end. And I certainly hope that, you know, I've heard some conversations with retailers. I also hope that as part of maybe this particular issue, but some other broader public place and other bylaw conversations that always engage, obviously, diverse communities who might be disproportionately impacted. You know, I think when I read this report, I was like, wow, I had no idea this is such a serious issue. But, you know, hearing from both bylaw, from EPS, and I also want to appreciate that, you know, your point that this comes from frontline experience, and these are the challenges that we're facing, and I think that's really important to hear for the council to hear. So just want to thank you for the work, and I look forward to. And I'm not clear on when. I mean, I guess when we the results of today's conversation and how that might inform that overall overhaul will come back when it comes back, right? So I look forward to seeing how this gets incorporated and how you know, the two bodies continue to work in partnership to fill those gaps, whether it's regulation or bylaw. So thank you for being here.
Thank you. Councillor Stevenson.
Yeah, on a very similar vein, really appreciate the work that's been done over many years. I know it's likely side of the desk work. So appreciate that you've kept the momentum up and then that you've got to this point. I'm pleased that our administration will carry it forward and work collaboratively with you from here. I think this is a really common sense approach, a really holistic look at how we address community safety issues. So thank you for that. I also think it's a great example of how our organizations can collaborate together to really achieve our shared objectives. So thank you for that and look forward to the work ahead. Thanks.
Thank you. Councillor Salvador.
Yeah, thank you. And I'll also be brief and just express gratitude for this report coming forward. And like I said, this has been an ongoing issue in the communities that I serve. So really pleased to hear the commitment from administration to work with the service to bring forward these amendments and really to add additional tools to our toolbox to prevent these products from being sold in an uncontrolled manner. And I was particularly interested in, what other municipalities were doing to restrict the sale of bear spray, to authorize vendors by imposing, the age verifications, name records, contact information of individuals that are purchasing OC spray. And it looks like this approach would result in similar requirements. So anytime we can provide additional bylaw clarity, I think that's really helpful in ensuring we have a consistent and rigorous regulatory environment, which ultimately will help support community safety. So thank you.
Thank you. Mayor Sohi.
Yeah, very quickly, again, appreciate the work that all of you've been doing and these suggestions coming out of your frontline experience, very valuable. One of the things that we always look for is how we can bring in changes that reduces the pressure on EPS, that reduces the pressure on fire service and other departments and which when we alleviate that pressure, it turns into cost avoidance, that you don't have to respond to all those calls. So these are thousands of calls that you have been responding to. If you can lessen that by half or whatever, right? That's less resources being allocated, the resources that can go to other much better needs as well, right? So I think this is part of that. I see that as part of that strategy as well, reducing the pressure on police calls and fire service calls. So look forward to their work being done in collaboration with the administration. Once again, thank you so much for your hard work. Yeah.
Great, thank you. Councillor Rutherford.
Yes, thank you so much. It's interesting because when I originally read the report, I was really confused about the problem that we're trying to solve. So I've had a few conversations leading up to today's discussion, and I want to just say that this has been very enlightening in learning about the nuance of this particular product, both in terms of things that I had never thought about, like just even the modification of labels, right? And how much harder that makes it for EPS to do their jobs. So it's been a very enlightening conversation, and I really appreciate the opportunity. I also am really grateful to the mover for bringing this motion forward. I was a little bit nervous about the directive nature of the recommendation and missing that ability to work collaboratively. And I actually think that this is going to create a better outcome in collaboration with EPS and our city administration coming together, especially around that work with a more comprehensive look at how we even regulate our public spaces. So thank you so much. It was a really enlightening conversation, and I appreciate everybody's time today. Thank you.
Thank you. Anybody else wishing to speak? Councillor Wright to close.
Thank you very much again. When I first looked at this report, I was just astounded by the number of uses, I guess, of the pepper spray. So it was a concern to me, hearing from my fellow council colleagues that where it's happening in their wards as well. And but I just didn't want sort of duplication of what was already being worked on, and I do appreciate the fact that EPS, our peace officers, legal, and everybody's going to work together on this. So again, thank you very much for the information. made for a good read.
Thank you. Please vote.
We have 5 votes.
Please display the vote. And that is carried. Thank you very much for taking the time to come today. Really appreciate your insights and your advice. Thank you.
Thank you for your time.
Thank you. Takes us to item 7.3, Anti-Racism Community Safety Fund Proposal. Good afternoon again.
Good afternoon again. Today I'm very pleased to bring forward this report, which is seeking council approval for grant awards of funds made available on a one-time basis. The $1.174 million were allocated from the remaining 2021 Edmonton Police Services budget held corporately in the Financial Strategies budget for redirection towards community safety and well-being initiatives. The 5 projects that you see before you today are within the spirit to which Council directed these funds to be used to make transformational shifts for historically disenfranchised communities. Although there were many applications and many worthwhile projects, there were limitations to the number of projects that could be supported based on the administrative line of sight, which informed the architecting of the program to utilize these funds. With the recent budget approval of an additional anti-racism and community safety funding, administration will be looking to align and harmonize a funding continuum to support a broad spectrum of future funding requests moving forward. At this time, we're very excited about these 5 projects and the opportunity these initiatives will have to create some positive outcomes in the community. We understand that many of the successful applicants have registered to speak, and they should be able to answer some more specific questions you may have about their exciting initiatives. Afterwards, of course, we'll be here to answer any questions that you might have of administration.
Great, thank you. We'll now hear from our speakers. And all of our speakers are joining us remotely. So first I have Jury Poligandla. Sorry, Jury, about that, from the Canadian Mental Health Association. Second, we'll have Dania Nur from the African Canadian Civic Engagement Council. And third, Laura Cunningham-Schapelli from the Edmonton Federation of Community Leagues. Reminder to everyone that that you each have 5 minutes for your presentation, so please watch the timer in the window on the Google chat. And once everybody's made their presentation, then all of committee and council will have the opportunity to ask questions to each of you. Thanks very much. Please go ahead.
Thank you, Councillor Cartmell. And thank you to all the committee members, councillors, Mayor Sohi, and city administration for this opportunity to speak today. What a long day. I guess this is every day for you. My name is Gary Poligandla, and I'm the Executive Director of the Canadian Mental Health Association, Edmonton region. I was born and raised here in Amiskwichi, Waskagan, which for thousands of years has been the home of indigenous peoples who were custodians of this land and shaped its spirit to be the global gathering place it remains today as the community we call Edmonton. CMHA submitted our proposal, design of mental health crisis responses and community-based supports for Edmontonians experiencing race-based hate, in partnership with and on behalf of the Multicultural Health Brokers Cooperative and the Edmonton Anti-Racism Lab. 3 organizations bring significant and complementary expertise to this project. The Anti-Racism Lab, formerly known as Shift Lab, has extensive experience harnessing human-centered design for a racialized lens to uncover new insights and develop new solutions. CMHA and multicultural health brokers each bring decades of experience as organizations providing mental health support and supporting capacity building for newcomer communities, respectively. This collaboration addresses needs identified by frontline workers and community members. So distress line crisis responders noted 2 years ago, actually just shortly after I started, the lack of protocols and guidelines for calls related to race-based hate. And the brokers have long recognized how important natural leaders are as the core social support fabric in ethnocultural communities for all things, including mental health and times of crisis. I noticed that the clock isn't ticking, so that I don't know if that means that oh, sorry, it is. I see it now. Thank you. Through this collaboration, we will design, test, and implement assessments and protocols for distress line responders to guide them when racialized Edmontonians call as a result of race-based hate or discrimination, and a toolkit and training for ethnocultural community leaders who are called on to provide informal support to community members in the aftermath of race-based hate and violent incidents. Fundamentally, our shared purpose is to develop a support pathway for people in mental health crisis due to acts of hate or racism at the front end by giving people an easy number they can call, the distress line, to talk to someone trained in evidence-based protocols on this topic. And following that, a network of community leaders and mentors who are similarly equipped to support them on their healing journeys. Frankly, this is a proof of concept, or proof of the obvious, I'd say, that has a broader, more universal application. Simple, predictable, and reliable paths to get the mental support we all need in ways that respect and draw on our identities, lived experiences, and community contexts. Aside from our proposal, I am equally excited by the project proposed by the African Canadian Civic Engagement Council, the Alberta Workers Association, Edmonton Mennonite Centre for Newcomers, and the Edmonton Federation of Community Leagues. I can only imagine the amazing ideas that were proposed but not recommended in this round. Above all else, I understand how important it is that CMHA and the other organizations being recommended today demonstrate our ability to positively change Edmontonians' experiences of and responses to hate and racism, especially how we can simplify help seeking and the ways in which our communities rally around people when they're in distress. This is all important, groundbreaking, and innovative work that is critical to make the city more comfortable and supportive for all of us, and work that needs to be amplified and sustained. I'm eager to connect with Dunya, Laura, and the other recommended proponents to see how we can leverage and connect with each other to lay a foundation that gives City Council and administration confidence and pride in maintaining these important investments in community organizations to lead anti-racism solutions well into the future. Thank you.
Thank you very much. We'll now move to Dunya Nur. Is Dunya with us? Oh, there we go.
Yes.
Very good.
Thank you. Thank you so much. Good afternoon, councillors, Mayor Sohi, and committee members. Thank you so much for having me. My name is Dunya Nur. I'm the president of the African Canadian Civic Engagement Council, and I'm joining you here today from Treaty 6 territory. The African Canadian Civic Engagement Council, acronym ASAC, is a national level organization that empowers and serves communities of African descent in Canada through advocacy, direct services, and research and policy analysis. Our vision is for a Canada where communities of African descent are equal, thriving, and respected members of society, and our mission is to empower and advance the rights and opportunities of people of African descent. Today, I will be speaking on Section 7.3 of the agenda, and I would first like to give some historical context. In 2021, our communities were shaken by the rise of hate-motivated attacks in our city. Our city witnessed a wave of hate-motivated attacks, and the primary target were Black Muslim women. This wave of violence was devastating and reminded us of the historical atrocities and the systemic racism and inequities that still continue in our society today. Consequently, this devastated our community and had a profound impact, and many of us questioned both our safety and sense of belonging in a place we call home. This was further exacerbated by the fact that many of the victims from our community and respected communities as well were unable to access effective, holistic, and culturally supportive wraparound services. Together, many Edmontonians, however, did march on the street and made a commitment to combat hate and stood in solidarity with those communities that were being targeted by violence. This was a reflection of the City of Edmonton's spirit. As a result, our organization started leading many discussions and we brought community members that were directly impacted by hate-motivated crimes and violence, and we also brought government stakeholders and grassroots community leaders. And therefore, we landed the African Canadian Civic Engagement Council's Women and Gender-Based Violence Prevention Program. The program was developed as a response to hate-motivated attacks against Black women, and over a period of 11 months, we served a number of complex and traumatic cases involving brutal attacks against Black women and girls. As a result, our organization became a trusted source for communities in their pursuit of both justice and healing. The program served Black women and children with complex intersectionalities such as race, religion, gender, social economics, and immigration status. Our key deliverables were court navigator, support resource navigator, legal directory, mental health support coordinator, and civic engagement. Our program initially was assisted to fund Black Muslim women that were going through hate-motivated violence. However, we noticed that a lot of our sisters that were not Muslim, but they were Black, were also seeking our services. Statistically, we served 15% of Black women who were not Muslim and 85% of Black women who were Muslim. Out of the 100% cases that we worked with, 35% was sexual violence, 30% was domestic violence, 22% was hate-motivated violence, 9% was gun violence, and 4% were homicide cases. What does that tell you? We also found that the cases of children, there was little attention in terms of research, and research conducted for child mental health by the time that the primary caregiver, typically the mother, was subjected to a wide range of violence. Our program found that Black women, Black Muslim women, and Black women in general hesitated reporting violent crimes, hate-motivated violence, intimate partner violence, and sexual violence to police because they have experienced series of deterrents from reporting, and our staff accompanied a lot of the women through our court work program to report, and we increased reporting. And we also worked with our other deliverables in the court work program as well. Also, I would like to thank our Mayor Amarjeet Sohi, who tabled a motion to have a 100-day anti-racism work with communities and ARAC and city administration to work together. Thank you, Council, on February 22, 2022 for unanimously approving the anti-racism strategy. As a community, we came together and we asked for an independent anti-racism body, high-level anti-racism administration, and core operation funding. I just wanted to conclude that the first round of the anti-racism project grants has demonstrated, and the city acknowledged, that when funding is delivered in such a small quantities for one-off project and is not connected to operational funding, such grant funding can actually weaken the grassroots BIPOC community organizations. Today, I'm here presenting our program Impact, the return of social investments. And also, not only should this be a one-time funding stream, but we need to actually talk about it, commitment to anti-racism by continuing annually and resourcing BIPOC community to strengthen their core administration and implementation. And lastly, we couldn't have done this without all the healthcare providers, institutions, community leaders, elders, and the women that we work with, and all of your support. And I thank the previous speaker before me, and I would love to connect and work together after this.
Thank you. We'll now hear from Laura Cunningham-Chappelli.
Thank you, Councillor Cartmell, and good afternoon, Community and Public Services Committee. Today I'm speaking to you from Treaty 6 territory, and I'm humbled to be able to come and speak to you on behalf of EFCL's application to the Anti-Racism and Community Safety Fund. The work that we proposed this year really builds off of what we learned from our Safe Walk pilot project that we ran in collaboration with Sisters Dialogue in 2022. The Safe Walk pilot program aimed to build support and safety for racialized and visibly Muslim women in Northeast Edmonton. The pilot was a response to violence, racism, and Islamophobic attacks in our city. Our model acknowledged the need for foundational work to create safety and trust at the interpersonal and neighborhood levels. Our aim was to increase a sense of community safety and well-being through building relationships between community leagues, community members, and Muslim women. This happened in two ways: the pilot of the Safe Walk model and the creation of a new community league program for Muslim women in the South Clairview area. The Safe Walk model worked best as a Sunday morning walking group in the River Valley. And what developed from this walking group was people showing interest in meeting in a park on a regular basis where women could bring their children and spend time together. So in close partnership with Safe Walk and Sisters Dialogue, the South Clairview Community League created a weekly mom and kids playground program. Posters were translated into French and Arabic and distributed to local daycares, grocery stores, the local Islamic Center, and other local organizations. So this program successfully engaged over 20 women and their children, Muslim women, throughout the month of August. From the success of this playground program, the South Clairview Community League then offered their hall once a month with the support of Safe Walk and Sisters Dialogue for the first two women's gatherings, which were held in October and November. And they saw over 40 women attend these gatherings where women shared food and talked about their culture. And the second event specifically featured Somalian food and had a reading from a local Somalian author who'd written a children's book. There was a presentation from the Hoyo Collective, which is an organization that supports African mothers. So these events and the relationships of solidarity between women and community leagues are the biggest change that we saw towards building supportive and safe places for Muslim women. This relationship building was needed in order for us to lay the groundwork to give people comfort with connecting with neighbors, to walk together in the future, and to collaborate on other community and safety well-being needs. So now participants are volunteering to take leadership roles in coordinating these women's gatherings in partnership with South Clairview Community League. They also reach out to the Community League president and to Sisters Dialogue as resources and have brought up different issues that matter to them. So the largest key to the success of these programs was the presence of Sisters Dialogue members and volunteers who are visibly Muslim women, who speak multiple languages and acted as like a cultural bridge between local Muslim women and the Community League and community members. So now that these relationships and program model have been established, the program is sustainable. Without our support, without Sisters Dialogue support, and the relationships are there, and that's what continues to work. So we want to expand this cultural bridge model to more community leagues and work to build diverse community engagement in leagues through creating spaces for that intercultural connection. We want to build the skill sets of league board members to create policies that promote accessible and inclusive spaces. So this is the intention of the work that we're planning to do with the 4 BIPOC grassroots organizations that we've built this with. So our friends at Sisters Dialogue, Bantero Traditional Healing Society, Ribbon Rouge Foundation, and Edmonton Multicultural Coalition. We intend to work together through 2023 to build more cultural bridges with up to 8 leagues this year and working with these organizations. And we'll bring workshops to the leagues using different approaches such as arts and drama, theater, music, bringing food, and so much more. We hope to bring neighbors together to share these experiences with people who may be new to the community league structure, but who call that neighborhood and that league home. So while we're thrilled and feel really fortunate about this opportunity, 1 year funding, as has just been identified, is only enough to build the relationships and start to begin the essential groundwork. So I plan to keep you and administration informed about our progress, about identifying our collective achieved outcomes, and bring you stories of connections between neighbors of all demographics and cultures that I know will be created through this funding. So like Gary, I look forward to connecting with the other successful applicants to understand how we can work together to grow this work across the city and really have big impacts around how we address racism in this city. The FCL is here to lead the work, and we're excited to work with our partner organizations in ensuring that these safe and local community league halls or safe spaces across the city. Thank you.
Thank you. We'll now go to questions of our guests. Councillor Tang.
Yeah, great. Thank you all very much for being here today and sharing more about your projects and organization and all the good work you do. Hearing lots of, collaborations on the ground, which is always wonderful. And I think all three of you have mentioned that it will be great to connect with one another, to hear perhaps mutual shared interests and, kind of finding other opportunities to partner. I guess I just want to maybe clarify, and since I have to pick a person, maybe I'll just start with Gary, if you can, since you brought that up. So that kind of conversation hasn't happened yet, is that right? But there is intent.
The direct conversation around these particular projects hasn't happened, but well, Laura, it's probably been over a year since we talked, and this is a great opportunity for connection. And Dunya, I think it's probably 1 degree of separation between us. So, and then of course with Mennonite Center, and then with Alberta Workers. I mean, the conversations have been happening, and I think this gives us actually something to focus on. So it won't take much.
Yeah, I imagine, working in, similar sector, there's always conversations about collaboration happening. And, there's a lot of proposals that didn't get, funded, but I don't assume, you know the projects or who apply and that kind of stuff. I'm just curious, would it be valuable to kind of know what other ideas that people want to do out there? I don't know, maybe Dunya? Maybe I was turning to Dunya.
Thank you. Thank you, Councillor Tang. I believe it is always valuable to know what other ideas is out there. And one thing that I know is, as a woman of African descent, we have this concept that it takes a village to raise a child. And, we're all a village at the end of the day. That's how I look at things. That's our worldview, that we're all interconnected. However, the only thing is that for us, our program really is a sensitive program that does require continuation of funding, especially in the area of domestic violence. We have and hate-motivated violence and sexual violence, and it's a complex program that we have a lot of collaboration and researchers and referral. We get referrals from Legal Aid Alberta, Edmonton Police, social workers, community stakeholders, hospitals. So unfortunately, it started with $50,000. Initially, we got $75,000, and we actually gave $20,000 to a Black Mothers Coalition working group to build their capacity. And then we kept 55, and that's how we excelled in terms of the prototype that we created. And therefore, we want to expand, and really, we have over 30 women that are on a wait list and children right now, and we're overstretched and we no longer can do the work. We're also an organization that made a commitment to advocate for our people. And unfortunately, some of the promises that was made was not delivered within the city of Edmonton in terms of operational funding and supporting Black-led and BIPOC communities and administration. So implementing this project actually it stretched us too thin. And as a president and CEO, I was on the ground and working and, making sure that the project was executed in a quality way. And you can understand the impact of that. So I'm here to advocate for us to get resources.
Yeah, thank you. And glad to hear that, there's also that principle too, initially, of resource sharing and building that capacity. And I guess maybe I'll just finally turn to Laura. The 5 finalists are fairly significant, sizable organizations. And I think in your presentation, you mentioned a number of groups. Some of them have maybe nonprofit status, some of them don't. I guess I wonder if you want to just elaborate on that kind of capacity building for groups that might otherwise not have access to, opportunities maybe this big. Or I just wondering if you want to elaborate on that.
Yeah, I mean, I can speak to it a bit. I mean, I think, you know, there's so much good work that's happening. So whether you have your nonprofit status or not, I think it's about what we're trying to find is organizations that are doing work on the ground, that are connected with people that aren't feeling connected in the city. Because I think that that's what we don't want women sitting in their homes feeling scared to leave. We want them to have safe places to go. And so if we have organizations we can work with that are open to working with us and have those connections and can help build stronger communities, that's what we're here for, right? And so I think we have the capacity to, you know, hire a person to do the coordination, to run the money through the organization, all that. So we're happy to play that role and then work with the other organizations to really sort of create something that's meaningful for them and Edmontonians.
Thank you so much.
Thank you. Councillor Stevenson.
Yes, really appreciate you all providing those presentations and the work that you're doing. Just a quick question for Ms. Noor. You mentioned it in passing, but I just want to dig in a bit, just in terms of, sorry, I'm going to sneeze. Oh, okay, I think it's passed. The implications of this funding being, excuse me, being 1 year only, and what that sort of means in terms of staff, you know, recruiting staff, that knowledge transfer, and also some of the momentum around the projects that you're developing.
Yeah, I would say it's really challenging, but because we're very connected to our community and we're grassroots organizations and we're, you know, asset based, we succeed and we manage to do it. But I personally believe that part of the City of Edmonton's commitment to anti-racism and the anti-racism strategy made that commitment to operations and budgeting and supporting BIPOC communities. Specifically, if you look back at the 3 commitments, the operational and capacity building funding, it actually talks about the City of Edmonton writes this report that the first round of anti-racism project grants has demonstrated that when funding is delivered in such a small quantity for one-off project and it's not connected with operational funding, such granting can actually weaken the organization's grassroots organization. So this is something that we really need to take into consideration. And today I highly do argue, based on my lived experience as a woman of African descent, as a Muslim woman, as, you know, a woman that has been targeted by violence myself and my family, and at the receiving and also at the service delivery and helping survivors of violence, that we really need to do better. And I believe with the councils that we have and with the mayor and with the infrastructure in terms of the city, I believe there are people that are willing and genuinely do care, and we can do better. Progress is slow, but the fact that this funding is put forth and you have 3 strong organizations that are really connected to community, Gary, Laura, and myself, this is one step, but like you said, funding can be increased and resources do need to be allocated to BIPOC communities. That's all I need to say.
Great, thank you so much. No further questions, but huge thanks to all of our speakers.
Thank you. I think that concludes questions to our speakers. Not seeing anything else come in. Sure, and check the chat line. I see nothing further. So thank you very much for all of you for waiting out the day and attending our meeting and sharing your thoughts with us. We very much appreciate it. Appreciate your insights and your inputs. We'll now turn to questions of administration. And we'll start with you, Councillor Tang.
Yeah, great. Well, first I'd like to just put the motion on the table first. That's okay. That Community and Public Services Committee recommend to City Council that the grant funding allocations outlined in Attachment 1 of the February 7th, 2023 Community Services Report, CS01550, be approved. And then I have some questions, hopefully one round. Yeah, and I think, Mr. Chow, I think it was a different grant program, and I had asked about this notion of, do the grantees come together periodically for communities of practice, and sort of kind of to the point of some of what the speakers mentioned around sharing and identifying perhaps other opportunities of learning. I'm wondering if that happens, and then I think there's obviously going to be conversations happening in the community, but how does city administration kind of plan to maybe facilitate or support
Yeah, that's a great question. So with previous grant applicants that were maybe unsuccessful, we meet with them one-on-one and we coach them and help them improve upon their applications. So that's one way to do it. We haven't fully gotten together that idea of bringing all of the applicants together per se, just quite yet. It hasn't matured to that piece. I think, you know, we see an example of these applications where there's some similar threads and common threads, where there are system actors and, you know, community actors where they have some common issues where they can see opportunities to collaborate. And I think that that's always the challenge, is, you know, finding out that right mix of when to nudge and really see the timing on whether the collaboration will work, or you know, what the level of readiness is for the groups. So again, at this higher level of funding and this opportunity definitely makes sense. But for the other grants, some of them are just so different, and there's not a lot of similarities, so we wouldn't push for those kind of things. But definitely we see those opportunities for sure. We built a critical mass with 2 cycles of funding, where I think we can do that this upcoming year.
No, great. And I was curious about that, what did you call it, education panel? And I think the way I interpreted that, and thank you so much for also laying out a very detailed, you know, kind of process of how something like this is done, and gives us a bit of that insight. And so this is so some of so there's 9 members from ARAC, even though ARAC is not active.
There was 1 member from ARAC participating, and then we did a call out for other community members that wish to participate. And, you know, looking at the diversity of those panelists that we talk about in the GBA Plus section, we feel very confident that we were able to get a really diverse panel that would look at the applications and give us the kind of feedback that we would need to have a robust process.
And there was city staff who kind of like went through the applications and kind of did that selection.
Yeah, there's a multi-stage process. We do kind of what we call the technical review to make sure that the applicants have the proper paperwork, the proper filing as a not-for-profit organization, you know, annual reporting, financial statements, logic models, and so we do that piece first. We had 55 applications that came in, so we kind of, as a staff team, did a short list first, because we didn't really want all the panelists to have to review 55 applications. And, you know, after that first initial stage, it was a very, very involved process. The 14 applications had to submit rigorous paperwork around project logic models, staffing models, descriptions, things like that. So we also didn't want to impose on groups that, you know, maybe wouldn't be successful, to have them go through such an involved process. This program differs a little bit from the other
the smaller
anti-racism smaller grant program, yes.
Right. I mean, just hearing you talk about kind of the amount of additional documentations that people do have to submit, I mean, you do have to be a fairly established organization to have the capacity to do that. Right, okay. So,
yep, that's correct.
So that in itself is a bit of a, perhaps not explicit, but it is a criteria essentially, is what I'm hearing. Yeah, I guess just, and just one last thing, I don't know if it's too early to think about this, about story, you know, sharing success, sharing stories, kind of, I don't want to call it reporting, because I find it so bureaucratic, but you know, there will be an opportunity perhaps for the community to come together and kind of hear about the outcomes achieved and, you know, success stories and all that across the project, right?
Yeah, absolutely. We're starting to compile some of the reports that have started to come in from the first cycle and the second cycle. So we're thinking of some ideas around some kind of showcase for the public and the community, and of course yourself, council.
That's great. Thank you so much.
Thank you. Councillor Wright.
Thank you very much. So I was sort of questioning as well, the intent this time around was the larger ones to the, I was just concerned that maybe we were excluding some organizations that hadn't had that past experience that might have some great ideas.
Yeah, for sure. I mean, there were a lot of great applications. You know, we put forward 14, and you know, the top 5 kind of are what we're presenting to you. We also didn't know at the time if there would be renewed funding. This was a one-time opportunity. So now that after budget we have an influx of additional dollars, there's an ability for us to kind of take a look at harmonization of those programs. There might be an ability for us to take a look at some of the applicants that didn't receive funding and see if there are opportunities that, you know, through a second cycle of this kind of funding that, you know, maybe they don't have to go through the same paperwork because we already have it. So we're exploring a lot of different options, Councillor, now that we have, you know, some line of sight that, you know, this isn't just a one-time thing.
Okay, that's great. That's good to know. Yeah, and I mean the organizations are very deserving and do have that past experience to pull this off, I think. So, I think. Oh, and you did say that you did have discussions one-on-one with those that weren't successful as well to help them learn.
Yeah, those are ongoing discussions. We still have to do some outreach and some further discussions with the applicants that didn't receive funding. And now that we know that we did receive some dollars in the budget, I think that's going to make those conversations a little bit easier, that we can work with them as we move forward.
Point them in the direction of where they can get those dollars from?
Yeah.
Whether it's city or provincial or federal? Okay.
Absolutely.
Okay, awesome. Thank you very much.
Thank you. Councillor Jans.
Just to speak to it.
Okay, thank you. Councillor Stevenson.
Thank you. Just a few questions. So just following from that, so I'm hearing that the budget decision sort of opens up the opportunities you can explore to consider multi-year funding potentially, and we don't need a policy change or direction from council for that to happen.
I don't think so at this time. Again, we haven't fully architected all of those, and you know, that idea of multi-year funding is definitely on kind of the mature side of the spectrum, with very higher capacity types of, we'll say, the traditional social services program. We see that through some of our other funding in the FCSS program. So we'll be looking at all of those aspects to see if those are relevant and if they apply to, you know, something like this kind of funding.
Great. And, you know, I noticed that none of the awarded organizations were Indigenous-led organizations. So appreciating that there are partnerships in place, but just wondering if that was, did we not see many applications from Indigenous-led organizations, or was it a matter of the applications not meeting all the requirements? Just wondering how we sort of address that and maybe shift that in future years.
Yeah, I mean, this is a one-time funding opportunity. We didn't see those applications. We know that based upon the budget that there will be a funding envelope dedicated now towards Indigenous communities. So, so we're hoping that we see those applications in the future, for sure.
And sorry, so for that dedicated, what dedicated funding would that be? I apologize.
In the budget, there was some funding allocated towards the Indigenous framework implementation.
Oh, okay.
And so it does speak to some kind of dedicated funding to help advance on MMIWG, Missing and Murdered Indigenous Women and Girls, and TRC.
Okay, but I wonder too, like, so appreciating those resources are in place, just wanting to make sure that Indigenous organizations still have access to this stream of funding through the anti-racism grants, and just wondering if there's, you know, proactive work that can be done on that front in terms of supporting organizations with their applications, or even just information sharing, getting the word out so they can apply.
Yep, definitely will do so.
Great, wonderful. And just, you know, so I've all of the information you provided to Councillor Tang's comments earlier, really, really valuable. Like it was just so helpful too, even to know that, you know, the full amount of sort of that shorter list was $2.87 million. And this might be an unfair question, but if you had unlimited funds, would you have recommended funding that 2.87, or do we feel that we really captured the projects, we funded the projects that that were the most viable?
Sure. So I think we heard Mike share with the applications that we had go forward, the 14 that we shared with the community adjudication panel, that there were some really strong applications in there. And so there's always a tension between, you know, where there's a certain waterline, I would call it, for basic eligibility requirements, and then there's sort of a gradation in terms of how closely are we mirroring the spirit and intent of the program. And so our feel was that there were certainly other very valuable projects being put forward by the community that we'll continue to work with going forward, but our recommendation was limited by the funds available in this round.
Great, that's very helpful. And just wondering what sort of opportunity we have to see the reporting on the outcomes. Would there be an annual report, again, that I think could help inform future decisions that we make around that fund in terms of seeing some of those metrics and outcomes?
I think those are some of the things that we'll definitely have to think about as we kind of look at the program and how we bring that information back to council. You know, this mechanism where these are council approved do allow for that, and so whether it be in the form of a memo or a showcase with the recipients, those are things that we're just going to have to explore this year.
Great. Yeah, I think that's really helpful, and I think you know, when it would be great to have, I think that idea of a showcase or a memo is really excellent. And maybe, you know, at a minimum as well, sort of the next time we're approving the next round, having a report back on the first round could be really helpful as well. But that's great. Yeah, thank you so much for the work. Appreciate it.
Thank you. I think that concludes questions of administration. We do have a motion on the floor. So speaking to the motion then, Councillor Jantz.
Just wanted to very quickly echo my gratitude to the speakers today and also to administration. On the weekend, I was reviewing a book by Irvin Waller called What Mayors Must Do to Stop Violent Crime, and it talked about the preventative and protective factors, including investments in this kind of work that our guests today have shared, and it really is quite compelling in how communities can make these upstream investments and help not only create a more welcoming and exciting and vibrant and beautiful community for everyone, but actually a safer community. So for those skeptics who have been, you know, suggesting that we need to be spending in other areas, I think collectively we as council and the applicants, the more we can draw that direct line from these sort of protective factors and investments to a reduction in harm and an increase in well-being, I think we'll all be much better off. So my ask would be that if there's a way to include councillors, even councillors who don't live in maybe the project focus area, in learning and sharing and telling the story about these kinds of opportunities in the city of Edmonton, I think that would be a really, really, really compelling story. I can think of a neighborhood in my ward where statistically it probably wouldn't qualify for any of your programs, but I know those residents would be so thrilled to know that they live in the kind of city that is investing dollars in the actions that you're undertaking. So thank you so much.
Thank you. Anyone else to speak? Councillor Tang to close.
Great, thank you so much. Thank you for all the speakers and also those you know, who are receiving this fund and not being able to make it. I think these are great examples of, you know, leveraging the dollars in this portfolio for community safety and well-being. So, you know, kudos to everyone and keep up the great work. And thank you very much for, you know, city staff for facilitating through that process. I do have a subsequent. I look forward to sharing after the vote. Thank you.
Thank you. Please vote.
We have 4 votes.
Please display the vote. That is carried. So, Councillor Tang, you're subsequent.
Okay, and do you want me to introduce now, and then we'll have go on break?
Yeah,
Okay.
let's put it on the table then. Yeah.
Sure, yeah. So I do have a subsequent. That administration conduct a participatory budgeting pilot in one or more of existing community grants program, including but not limited to anti-racism, community safety and well-being, and neighborhoods, using lessons from various jurisdictions, including national and international examples, as well as local examples such as the Garehio and Nakota Iska community-based budgeting project, due date Q4 of 2023.
Great, thank you. Do you want to introduce that now?
Yeah, happy to give a bit of a context for this and welcome questions and feedback on this. I think since the 2021 election, I think this council and in this room we talk a lot about things like anti-racism and decolonize. And for me, those words carry a very specific meaning, which is around the notion of power and how we hold on to that power, how we share and distribute that power. I think, what the report that we just had, it's a very fine report, and I think I love all the recommendation, and I look forward to hearing the work. But I think when I read through the report, I couldn't help but notice the way that, the city sets up the process. We determine the criteria, we determine the selection panel, and I can't help but wonder what would it mean to actually fundamentally change the way those things are structured. With the anti-racism strategy, as one of the speakers already talked about, when we talk about things like independent body, those are very structural changes, and I think we can do more. Participatory budgeting is a very particular method, and I know people have used the words before, but there's a very specific meaning in that. And in the book, we're talking lots about books, Decolonize Wealth, Edgar Villanueva, the author, he calls into question about how funders, whether they're philanthropists or they are, governments, can fundamentally shift the way power rests, and, more specifically, letting go and sharing that decision making. And it made me wonder about, what is possible within existing, city, programs or opportunities. And this is kind of a way to, I guess, I like to challenge administration to think about that, more kind of from that structural change kind of perspective. And this is a way to kind of see what will work. And I'm a little bit outdated on all my city grants, and I know they really range from really $300 grants to hundreds of thousands. And I'm not necessarily tied. I really look forward to hearing any conversation as a collective, as a community that we can have about this, and see where we can start to kind of chip away at that structural change that we always talk about. So thank you very much.
Great, thank you. Any questions? If there's no questions, then we're done. Councillor Wright? Just go ahead, Councillor Wright. Yep.
Sorry, to the mover, the results of the participatory budgeting that you did with yourself and Councillor Nax.
Yeah, only preliminarily, and this is why I think I encourage the city administration to look, at lots of different examples. This is a method that's been practiced since the 70s across the world in communities, small and large, and it's done there's different shapes and sizes and methods to do it. This past year, Councillor Knack and I kind of engaged in this process with our residents in our wards in this process. We're still in the process of evaluating, but we'll be very much happy to share what we learn along the way. I can say that already we're hearing so much around kind of personal impact, but community impact, but also this idea of trust. Trust with institutions and vice versa. And this idea of, you're coming to us rather than us coming to the city. And I think those are often things that we don't talk about in grants. And I just like us to start to explore that a bit more.
do something a bit different. Yep.
Yeah,
Okay.
absolutely.
And administration, do you see any challenges, barriers to doing it this way?
We're certainly open to having the conversation about exactly what it looks like mechanism-wise, but I don't see any large barriers to exploring this. Thank you.
Awesome. Okay, thank you.
Thank you. Any other questions for Councillor Tang or for admin? Fair enough. Anyone caring to speak to the motion? Councillor Tang, anything further?
Yeah, I do, actually.
Fire away.
Okay. You know, I think last year when Councillor Knack and I kind of did this project, I'm sure it was lots of, you know, this is a small project, not a big deal, and I think what we've learned through the process has been quite powerful. You know, people, you know, one person has said this was a completely different experience than traditional grant opportunities. There was a culture of support and abundance from the very beginning. And applying for grants often feels like begging, and there's a constant need to prove yourself. This experience was very much the opposite. There was a spirit of excitement and enthusiasm for all of the projects. And I highlight that not so much to downplay our existing grant programs. I think we have, you know, we've done so much and the impact is huge. But I think it raises question around abundance and the deficit. I think it raises a question around relationship between communities and city government. And if we're really working towards anti-racist city, I think we also need to think about how we fundamentally change the relationship we have with various equity-deserving communities. You know, it is a pilot, so I'm not attached to the outcome. You know, if in the end community says, actually this doesn't work for us at this scale or this format, you know, I am more than happy to kind of drop it, but I think I'm just curious, you know, I am always thinking about those who don't make the cut. You know, what ideas are we missing out there? Could there have been opportunities, maybe through some of the ones that did make the cut? Is there ways to kind of leverage? Are there ways of sharing resource and building new kinds of relationship? And, you know, in so doing, tap into communities that we might not otherwise reach. And those are the things that we've learned. And I can't wait to see, you know, what the city does. I do think having the ethos of agility and, you know, that ethos of relationship, like authentic relationship building is really, really critical. And this, I also just want to clarify, it doesn't replace, it's not meant to really replace something entirely. I think, however, administration decides to, the scope of the project, if you want to do carve out a portion of an existing grant, test, you know, maybe a small grant program somehow, I'm gonna leave that entirely with you. And but I just wanted to see some movement at the corporation level rather than you know, small projects here and there. That's it. Thank you.
Thank you. Please vote.
We have 4 votes.
Please display the vote. That is carried, and that takes us to our afternoon break. So we will adjourn until 3:45. We have item 7.4 left, and we have a late registration of a speaker on 7.4. See you at 3:45. Thank you.
Good afternoon. We're back live in River Valley.
Thank you. I'll call our meeting back to order and take us to item 7.4. Before we start with the administration's presentation, we have a speaker that has joined us, so I'll just move that we hear from Judith Gale from the Bear Clan, and I think she's virtual. So please vote on adding that speaker.
In favor.
We have 4 votes.
Please display the vote. And that is carried, and we'll go to administration's presentation then.
Good afternoon again. The report in front of you today addresses the second half of a motion made in April 2021 with respect to the use of restorative justice to address acts in the community which contravene the amended anti-bullying and harassment section of the Public Places Bylaw. With us today for this discussion is David Jones, Branch Manager of Community Services and Neighborhoods, Nancy Jacobson from Legal Services, and James Junio, Director of the Peace Officer Section. I'll pass it on to David for some further introductory remarks.
Thanks, Stacey, and good afternoon again. In April 2021, we were given direction to explore the use of restorative justice to address the amendments of the Public Places Bylaw, which sought to have a significant impact on the safety in our public places, especially focusing on harassment and bullying fed by racism, hatred, and bigotry. To explore this possibility, we examined both the overarching administration of justice and conducted community engagement to explore the appetite for the application of restorative justice for these acts. Although restorative justice practices have many positive outcomes, the investigation done for this report also reveals several procedural challenges and barriers. The feedback collected from 2 focus groups and consultations with a group of experts and 1 stakeholder group about using restorative justice within these sections of the bylaw were mixed and inconclusive. Although there was some interest to learn more about the potential, there were also some cautions about this perhaps being an inappropriate alternative justice practice for the situations involved in these particular sections of the Public Places Bylaw. And I'd further comment that given administration's overall bylaw review and modernization process, a more holistic examination of various alternative justice practices will be completed once that process is complete. And we'd welcome your discussion and any questions you may have. Thank you.
Great, thank you. We'll now go to our speaker. So just making sure that Judith Gale is with us.
Yeah, present, thank you.
Very good. And you've been here before, so 5 minutes and you can see the timer on the screen, and please go ahead. Thanks for coming.
Right on. Thank you for having me, guys. Oh, sorry, a wrong button. Okay, there I am. Hi, guys. Okay, so I'm talking today about the bylaw 14614. Now, we've been at this table before, and I'm sad to say that I feel that we have taken steps backwards instead of steps forward. And I'm very concerned about that, as I represent our brothers and sisters who are directly impacted by your purview today. So what I'd like to talk about too is the restorative justice process, as well as how unfair it is to be ticketing our brothers and sisters who most often are the subject of these tickets, of these enforcements, these bylaws. And in particular, it's to me and to our brothers and sisters, it really feels like harassment and punitive measures given to the part of our society that is lost in addictions, in so much mental health and intergenerational trauma. And they couldn't even think of where they're going to be sleeping cozily that night, let alone figure out how they're going to pay a bylaw fine. And I understand they do infract those bylaws quite often. I've seen it in our day-to-day patrols all the time, and I'm always the first one to point out to them that they shouldn't be doing that, you know. But we're talking about people that don't have the wherewithal, the sense-all, nor the capacity to understand these simple directives because of addictions and mental health issues. And you know, so to me it's, and to our brothers, it feels that it's coming from a punitive place, harassment, because they are the ones that are usually subjected to these instances, you know. And so that's what I really want to stress, is that it's added stress onto our brothers and sisters' lives that they just can't deal with. And then it also leads to imprisonment. It leads to the public at large feeling unsafe because they have to witness these interactions, you know. It's also it leads to so much negativity, animosity that's not good for anybody. So I'd like to see this bylaw to reference the mental health, the psyche of our brothers and sisters at that incident, as well as, you know, I feel that EPS and peace officers work tandemly to point at our brothers and sisters just to see if they have a record or stuff. You know, here we can now we've got you. We're going to run your name through, and then we're going to even get you even worse. Anyways, these kinds of incidences happen far too often, and it's just not good. And as well, EPS. Not EPS, Edmonton Transit barring out people because of too many bylaw infractions. That's just giving a 2-year ban from ETS because they've infracted too many bylaws. You know, this kind of mentality is not a good and safe public space for anybody, let alone our disenfranchised, poorest of the poor, meekest of the meek society. So thank you for listening, and I hope that I made some sense. All right.
Well, thank you very much for being here. We'll see if there's any questions for you. Looking around, Councillor Stevenson, go ahead.
Yeah, thank you so much for being here with us today, Ms. Gale. You know, appreciate your perspectives, and I know we've talked in the past just about some of the emerging work that's happening based on the Safer for All report around how we build in accountability mechanisms for our peace officers. Just wondering if you feel that a restorative justice approach might be appropriate in those cases where there's a complaint from a community member against a peace officer conduct, for example, if you see a space for that being productive.
I have been involved with EPS, restorative justice process, and I'm not impressed. And therefore, I don't see, especially in a law enforcement kind of deal, I don't see that restorative justice is a good idea because it involves all parties to be participants. Now, all parties don't have to be participants under EPS. You know, they can, the sergeants or whoever can say, no, I don't want to be part of it. And then that ends that. So a restorative justice only works when all parties have an invested interest in performing that restorative justice. And as it is, it's not mandatory, it's voluntary. So.
Right. No, that's an important nuance. And recognizing that all parties need to be willing actors for that process to be successful. Do you think that having that as one of numerous resolution mechanisms, so if there could be sort of a more standard conduct review process, and also an option for restorative justice, do you see that as avoiding that challenge potentially?
Yeah. Oh, yeah, absolutely. I think that that's where, some meaningful dialogue could come from for sure. And, we want to treat all people with the same humanity. Police, peace officers, counselors, mutual aid people, and we all want to be on the same page and be respected. And that includes our brothers and sisters too.
Great. Well, thank you so much. Thanks again for being here today.
Thank you, Councillor Wright.
Hi, thank you, Ms. Gale. I'm just wondering, is there another approach that peace officers could take when
having to do fractions?
Yes.
Oh, for sure. Absolutely. I believe that we have to put in our bylaw some stipulations that reflect the drug epidemic that we're currently in, that reflect the houselessness that, I feel that if you have a myriad of roadblocks against you, so to speak, then a bylaw ticket shouldn't be one of them. If you're unhoused, if you are steeped in addictions, if you are mental health, if you are, like our brothers and sisters, so many are, then I believe that not that you should be exempt, but that maybe perhaps a different approach, like a more perhaps, okay, I hate that 3 strikes and you're out kind of thing, but maybe with I'm a mother, so when I mothered my children, I used to do the 1, 2, 3, 4, 5, and then you're in real trouble. You know what I mean? What? Don't make me count to 5. And then so my children listened a little bit better. And they never want mom to be at 5 ever. You know what I mean? So maybe some sort of that. Where we're dealing with our brothers and sisters in a more easier fashion because we understand their limitations.
You're more lenient than I am. I only went to 3. But I'm thinking maybe like referral to resources that would help them. That might be a better solution than the restorative justice practice?
Yeah, absolutely. I think so. Currently, what we have right now for our brothers and sisters that really help in the justice system is called drug court. So when our brothers and sisters are drugging, have so many legal matters attending to them because they're addicted, because they're always caught with little substances for their personal use and stuff, then they're actually put to a area called drug court, which reflects what their each person nuances is, right? What led them to why they became addicted, why they were doing all these infractions. I mean, it all comes hand in hand together, right? So yeah, if we could do something like that, that would be great.
Okay, all right. Thank you very much. And I'll yield the rest of my time.
Thank you. Councillor Tang.
Great, thank you so much, Judith. Thank you for speaking so passionately as always. I guess I'm I think it feels so relevant. We've had a very extensive discussion this morning about the impact of homelessness on the public health system, and I think you really kind of summed it up that it's really about that balance with some of all these social and health needs as well. And I think for many of the reasons you had mentioned about the voluntary, or I'm sorry, willing participation among other challenges, that restorative justice isn't actually recommended in this report to kind of be part of the public place bylaw. But I was curious whether, as part of Bear Clan or not, have you ever seen restorative justice work?
Oh, I have. Yeah,
share.
absolutely. Yeah. Absolutely. We have seen that. I'm from the Northwest Territories, Treaty 8, and from our Dene Nation, they practice that quite a bit, where instead of, say, for instance, in a small community that's very traditional, the Discharge community, what they do is that if anybody breaks any laws, then they're paired up with an elder who then takes them to an island and stays with them on that island and tries to work through the problems, the issues that the human being has been going through on a one-to-one basis. And then once that elder feels that that person is understood and they feel together that that person can re-enter community in a good way, then both of them come back into community and they're welcomed with a big ceremony, and it works. It really works because it shows that community cares and loves for you, regardless. Even if your own family has thrown you away, it shows that the bigger community can still envelop you and you can still be part of it.
Yeah, no, excellent. Thank you so much for that example. And I think you had mentioned earlier that perhaps kind of in the current, law enforcement context, sort of having a very formal program or system might not be the best path forward. But there are certainly principles of how that may be how we operate or how we practice things. That's not so formalized, but there's a principle of doing things, building relationship. And I'm curious, you talk a lot about individuals and their interaction with law enforcement. What about groups? For example, Bear Clan and its relationship with, say, transit enforcement, is there some principle of restoring those relationships that can perhaps lead to better outcomes?
Oh, for sure. I would much rather see our transit people and our peace officers in tow with a community outreach person rather than a EPS or a peace officer, because that shows that community is friendly and that not so big brother encroaching kind of feel, especially for bylaw issues. Not every human being, I was reading the bylaws, and not every human being infracts those bylaws. So, and the ones that really do are our brothers and sisters because of a myriad of problems, right? So, yeah, and I just remembered another example, Councillor Tang, about restorative justice. So in Montreal, Quebec, that's where I was brought up, in Montreal, Quebec. I was a 60s scoop, and that's where they sent me, was in Montreal. Over 5,000 miles away from my own community, but I thrived, as I always do. And so I in Montreal, what I know from friends of mine that work in the nonprofit field, they have said that there's a program that's very successful, and that is that they have taken over the cleanliness of the downtown area through restorative justice. So, for instance, a brother or a sister gets ticketed for smoking in public spaces or for open drug use or, stuff like this. Well, then they can then take those tickets and clear them up by going to a nonprofit or an organization like us and say, I would like to enter in a work plan that's through the city in conjunction with the city, where I can clean up from Street Guy to Peel Street, and that will be payment for my infractment. Infractment.
Thank you so much. Yeah,
So, it
I'm
helps
way
the
over
city,
time.
It helps people.
Yeah, but I appreciate you sharing. Always intrigued by those ideas. Thank you very much for being here.
Thank you. I don't see any more questions for you. Ms. Gale, just making sure everyone has a chance. So thank you very much for joining us this afternoon. We really appreciate your comments as always.
Thank you.
We'll now go to questions of administration. We'll start with Councillor Tang.
Yeah, thank you very much for the report, and I appreciate the recommendation. I think is practical. It's I feel like there's this clearly there is some alignment too with what's the community feedback as well. But I guess I just want to maybe as an opportunity to maybe share with everyone here. You have mentioned the provincial restorative justice program. It's been 2 years. It was during the pandemic, but wondering what kind of conversations been had there and how are they doing? Like, is it happening?
So we don't have a direct line of sight because our fences don't go directly through them, but from what we've heard, just anecdotally through our community, things are going well, and also some of their newer offerings like the Edmonton Indigenous Court is going remarkably well as well, even though it's in its very early stages.
Can you tell me more about that one, the Indigenous Court?
Yeah,
I feel like it was the first time I saw it, and I'm like, tell me more.
Yeah, for sure. So it was established later in 2022, and essentially it's judges and prosecutors, defense counsel, and support workers come together at a level playing field to talk about the fence and employ culturally relevant and restorative justice practices to work through offenses with offenders. So again, very, very early. They're just starting out. They only do it once a week, but everything that we've heard has been great.
But it's through the province, but specifically for Edmonton area?
It's specifically for Edmonton area. They're modeling it on ones that exist elsewhere in Alberta.
Interesting, yeah. Yeah, and David, we've kind of talked about this beforehand too, but justice is not within our jurisdiction. So I can appreciate the recommendation here, but given that there are kind of broader level programming happening, what can the city's role be in terms of a bridge or facilitation or relationship building? Judith mentioned referral. I know we do that to too much of an extent, but how do you see those maybe tactics play a role in connecting into existing restorative justice programs?
Maybe I'll jump in and then I'll ask Nancy to save me. I think, so for the purpose of this report, we were looking at the harassment section. So with respect to, somebody feeling bullied or humiliated because of a whole number of sort of identifiable issues, sexual solicitation, that sort of thing. And I think for that purpose, and knowing that our ticketing rate for this section of the bylaw is really low, restorative justice may not apply. I think some of the feedback that we got from our community engagement suggested that it was maybe inappropriate to use restorative justice for some of these issues because it would unduly put emotional labor onto folks who are really being victimized in the community. And so for that reason, we're saying maybe we need to take a broader perspective. Restorative justice may be one tactic that we can use. And I think going back to some of those conversations, one of the issues becomes as soon as we write that ticket, it goes into the provincial system. And then we're really, you know, Nancy can tell you more about that process, but we're kind of beholden to the way that the province is running the larger scheme of justice. And so, you know, I look at what we can do before we write that ticket, and really we try to bring that ethos of, you know, engaging folks, explaining to them what the rules are, really, you know, educating and encouraging people before we do any of that enforcement. So we know that, I don't have the stats in front of me, that we know that our cautions, our warnings, all of those numbers are significantly higher than any tickets that we write based on a number of different bylaw infractions. So those are all pieces of the work that we're doing that is upstream of anything that gets into a formalized justice process. So for that reason, you know, we're doing what we can in this moment. I think following the bylaw review, we're going to crack open the books a little bit more of like what else are some of those options. But I'm not sure if you want to jump in and comment anymore.
I think that was a really great summary. Our work is predominantly in that space of pre-enforcement, not recognizing that once we enter the provincial program, even with the great programs they have in place, they tend to be confined to criminal offenses and provincial offenses. And at some point they get down to the bylaw world, but it takes a lot longer.
I only have 10 seconds, so I might need just come back for this, but I was curious about the bans that was raised from the earlier speaker. Like, that is not a ticket necessarily, and that would be within our bylaw, wouldn't it?
So that would be, but I mean, that's outside of the sort of the purview. We wouldn't.
The scope of this, okay.
We could use it for this one, but I think if the situation was terribly egregious, we'd look at writing a ticket in order to kind of direct, you know, something harassment based on racism, sexism, et cetera, in the appropriate manner.
Okay, sorry, thank you.
Yeah.
Thank you, Councillor Ray.
Thank you. Yeah, my sort of confusion or question was in regards to how would it actually practically play out, given that it does go to the provincial system. So we don't really have any jurisdiction then to direct the province to institute that restorative justice practice?
No, you're correct. We are in a system where our role in our space really is about that discretion and that work we do before that ticket is issued or choosing alternatives to ticketing. Once that ticket is issued and enters the provincial court process, we have to work within that provincially and federally regulated stream. And they're doing great work, but it just hasn't caught up with the bylaw world yet.
Okay. Okay. And then the cost to run some sort of program, I guess, before it gets to ticketing? What?
I'm not sure if we have a cost number on that, only because we don't really have anything in place that would, you know, we don't have anything in place necessarily that we could direct. We do have the contract with the Mediation and Restorative Justice Center of Edmonton. We would have to speak to them about whether or not our existing contract covers something more in-depth and maybe a little bit more formalized. Right now, we use them mostly for property issues with respect to bylaw offenses. When somebody calls about a fence being out of whack and it's clearly, you know, we just got to work things out between the neighbors. We will often refer things on to them, but I think this would be significantly more work and effort, and so we'd have to look at what that might be as far as costs go.
Okay. And do the peace officers have any way of tracking recurrent incidents for people? Do you track the warnings or?
Yeah, we do. Sometimes, you know, out in the field, there's time to do some of those checks, and oftentimes some of the peace officers will know folks who are those repeat offenders. I know when I was out once with the transit peace officers, they encountered somebody, and it was the situation of like, hey, I thought you'd gone to, live with your mom in Calgary. Oh, that broke down, so I'm back in Edmonton now. Okay, so this is the 7th time we've had to deal with you for smoking in a transit facility. We can't write you any more tickets. How are we going to convince you not to do this anymore? So it really approached it in a more holistic way, but lots of times they'll know that kind of that repeat process in their head. Otherwise, we do track it, and they kind of keep tabs on who's kind of the
habitual offenders?
The habitual, that we have to figure out different ways of dealing with it.
Okay.
Yeah.
Okay. And then one last question. In the report, it says to work with ARAC. That, I'm assuming, was not possible?
I believe in 2021 and 2022, we reached out to ARAC. We didn't get any specific guidance or feedback from them.
Okay. Did you get any other sort of community? I'm just taking a look at the GBA.
Apparently I'm having troubles working my mic here. We did a community engagement process. We reached out to a number of internal resources as well as external resources and collated all of that information into some of what you have here. Yeah.
Okay. Okay. I just wanted to make sure that perspective was gained. Okay.
Yeah.
Thank you.
Thank you. Councillor Stevenson?
Yeah, thank you. I really appreciated the report, really appreciated the conversations they've already had with community and, really important insights coming back. When I was reading through an idea that occurred to me is, we do have a recommendation in the Safer for All report in terms of looking at our accountability mechanisms for peace officer conduct. And just wondering if a restorative justice process, again, as maybe an option of a stream for that may be valuable. Also in recognition that I think there could be value for the officers as well, given the really challenging situations that they're navigating on a daily basis.
Yeah, I think there are a couple issues that would come into play there, and I totally agree with you. And for the record, I think there are lots of really great and valuable applications for restorative justice. I think with respect to officer complaints, misconduct, whatever we want to call it, we have to look at a couple of different overarching pieces. There's collective bargaining agreements that we'd have to make sure that that kind of process was in line with, and also for any of the peace officers, the Peace Officer Act and regulation governed by the province, we'd have to make sure that the way in which we approached those professional standards investigations adhered to that as well as anything else. But I think that's work that's, you're right, from the Safer for All report that we're engaged in and that we're building on as just a different stream of work under the CSWB banner. Yeah.
Perfect. Yeah, and no need for further direction today on that, but hope that this is an idea that can be brought forward through that work, and really looking forward to that coming forward in due course. So thank you.
Thank you. Councillor Wright? Just moving the recommendation. Anyone else with questions? Go ahead, Councillor Wright.
Okay, I move that the February 7th, 2023 Community Services Report CS 00751 be received for information.
Thank you. Any introductory remarks? Yes, no?
Thank you for the information.
Yeah. Anyone caring to speak? Councillor Wright to close. All right.
Go ahead, Karen.
No, I don't have. All right, Councillor Wright to close, yeah? Anything further?
Nothing further.
All right, please vote. We have 3.
We have 3 votes.
Please display the vote. That is carried. That completes all of our public reports for the day. Are there any motions or notices of motion or motions without customary notice? Seeing none, we are adjourned. Thanks, everybody.